10:10. Good morning, everyone. Committee will come to order. Want to welcome everyone for the first full committee markup of the Energy and Commerce Committee for the 112th Congress. And before we get started, a quick word on how we're going to proceed today. First, I'm going to recognize myself and Ranking Member Waxman for 3 minutes for an opening statement. Next, the subcommittee chairs and their ranking minority members for the matters before us today, Representatives Pitts, Pallone, Stearns, and DeGette, will be each recognized for 2 minutes for an opening statement. Then I'll recognize any other member seeking to give an opening statement for 1 minute, and we'll alternate between the two sides. As you know, under our committee rules, all printed opening statements will automatically be made part of the record for markups. And after the opening statements, I intend to move first to the health legislation before us today in this order: H.R. 525, the Veterinary Public Health Act; H.R. 528, the Neglected Infections Act; H.R. 570, the Dental Emergency Responder Act; and finally, H.R. 358, the Protect Life Act. Finally, following the committee's legislative work, we'll move to the Committee Oversight Plan for the 112th Congress. I'll be offering a substitute to the plan that has been worked out with the minority, it is my understanding. So with that, the chair recognizes himself for an opening statement for 3 minutes. I will work the clock. I want to commend Chairman Pitts and the members of the Health Subcommittee for bringing 4 pieces of the legislation for our consideration today. 3 of these are bills that were worked out in the last Congress but never reached the President's desk. They passed by voice vote in the subcommittee, and I'm sure that they'll enjoy similar support today. Last week during a Health Subcommittee hearing, Professor Rosenbaum correctly pointed out that the Protect Life Act would bring health reform into line with what was a Stupak-Pitts amendment that the House adopted by a strong bipartisan majority during the 111th Congress. As was the case with Stupak-Pitts, this bill includes the Hyde Amendment language that has been continuously adopted by Congress since 1993. Legislation also includes a conscience protection language that was adopted in the committee by a unanimous vote during the 111th Congress and included in the House-passed Affordable Care Act. Unfortunately, the conscience protection language was not included in the Senate bill that ultimately became law. The Catholic Medical Association, CMA, the largest association of Catholic physicians in the U.S., sent a letter to Chairman Pitts on February 10th in which they said that H.R. 358 corrects significant flaws in the Patient Protection and Affordable Care Act regarding abortion funding and protection of conscience rights. CMA President Jan Hemstead said this: over the last several years, there have been a variety of attempts to compel and to justify compelling physicians to violate their conscience by performing acts they hold to be unethical. These attempts, if successful, would violate significant constitutional and human rights and undermine physicians' professional judgment, which should always include an ethical dimension. Based on a recent survey, Dr. Hempstead continued, we found that a significant percentage of our membership would abandon the practice of medicine rather than to surrender to coercion of this kind, undermining access to medical care for a significant number of patients. So after our work on H.R. 358, the committee will turn to our oversight again for the 112th Congress. I will speak more on that measure when the time comes. The chair recognizes now the gentleman from California, Mr. Waxman, for an opening statement.
Mr. Chairman, it's with mixed views that I come to this initial legislative markup of the Energy and Commerce Committee of the 112th Congress. On the one hand, I'm pleased that we're taking up 3 small but important public health bills on veterinary medicine, impoverished diseases, and emergency dental responders that both the committee and the House acted on in the 111th Congress. These bills are bipartisan and deserve our support today. I'm also pleased that we worked together on the Oversight Plan. On the other hand, I very much regret that we are also considering as our first real legislative effort this year a bill that is not only unnecessary and unjustified, but also extreme and contentious in its approach. Procedurally, this bill is flawed because its constitutional basis, a requirement set forth in the Republicans' own House rules, has not been identified. This is a serious flaw for a bill that injects the federal government into the most personal decisions of women and families. But more than that, H.R. 358 is an attack on one of the most hard-fought but delicately balanced provisions of the Affordable Care Act, those related to abortions. Those provisions, authored by Senator Nelson, whose pro-life record speaks for itself, clearly and unequivocally prohibit the use of federal funds for abortion, keep state and federal abortion-related law in place, and ensure that those whose conscience dictates against abortion are protected and not discriminated against. H.R. 358, authored by Representative Pitts, goes far beyond this. It will shut down all or virtually all private coverage for abortion services. The bill also takes away the Affordable Care Act's limited anti-discrimination protection for those providers whose conscience dictates that women should have access to abortion, a legal and medically appropriate service. And among its most disturbing provisions, the Pitts bill would upend the Affordable Care Act's requirement that health care providers remain obligated to provide emergency services as required under EMTALA. Taken as a whole, the bill is a full-throttled attack on abortion. It will take a woman's right to choose by effectively eliminating coverage for these necessary medical services in insurance policies. This legislation should not become law. It is not what the American people want. November's election was a mandate for jobs and economic growth. It was not a mandate to erode the rights of choice that are protected by the Constitution. In my view, the abortion provisions included in the Affordable Care Act are far too restrictive. I do not want us to turn the clock back. Abortion should be treated as we treat any other legal, medically appropriate service. This bill should be the standard of review, and I urge members to oppose it.
Thank you. Gentleman from Pennsylvania, Mr. Pitts, the chairman of the Health Subcommittee, is recognized to give an opening statement for 2 minutes.
Thank you, Mr. Chairman. Last year, Congress passed the Patient Protection and Affordable Care Act without language to uphold the long-standing federal ban on funding for abortion and abortion coverage. Members on both sides of the aisle and the vast majority of the American people believe that taxpayer dollars and government subsidies should in no way fund abortion. In poll after poll, 60 to 70% of Americans support this position, a position that President Obama endorsed in his executive order following health care passage. It's unfortunate that Congress, in its haste to pass health reform, failed to continue this policy. To fix this mistake, I introduced the Bipartisan Protect Life Act. My legislation will apply the Hyde Amendment to health care reform, continuing the historical prohibition of federal funding for abortion. This bill also codifies conscience protections that have been afforded to health care professionals for decades. These conscience protections were originally adopted in this committee last Congress by a voice vote, yet were deleted before the final passage. In recent days, we've heard claims that these conscience protections may be in conflict with EMTALA, the Emergency Medical Treatment and Labor Act. Let me be clear, there's no conflict. The EMTALA statute, section 1867E of the Social Security Act, calls on emergency personnel to respond to distress on the part of a pregnant woman or, quote, her unborn child, end quote, by stabilizing the condition of both mother and the unborn child. Clearly, the Protect Life Act provides conscience protection that is consistent with the emergency treatment requirements of EMTALA. It was also suggested during the subcommittee hearing last week that insurers might deny claims for injuries that occurred after an abortion. While this argument serves to remind us that injuries and disorders are indeed caused by abortion, nothing in this bill can be construed to forbid or discourage coverage for the treatment of a condition arising from an abortion. The issue of abortion is a contentious one. This debate here is quite simple, though. On the one side, we have those who want to open up the federal coffers to the abortion industry. On the other, we have the American people who oppose federal funding for abortion. For 30 years, Congress has prohibited federal funding for abortion. Health care reform changed that. We have an obligation to ensure that this time-tested policy remains intact. I urge support for this bill. Yield back my time.
Thank you. Gentleman's time has expired. The chair will recognize the ranking member of the Health Subcommittee, Mr. Pallone, for 2 minutes. Statement.
Thank you, Mr. Chairman. I want to reiterate my support for 3 of the 4 bills being considered by this committee today: the Dental Responder Emergency Act, the Veterinary Public Health Workforce and Education Act, and the Neglected Infections of Impoverished Americans Act. Each of these are bipartisan, common-sense bills. Last fall, they passed this committee in the full House, and my colleagues, I guess they failed in the Senate, so I'm pleased that we're trying to move them forward today and quickly. Unfortunately, today in the mix is a bill that attempts to dismantle the Affordable Care Act and roll back women's reproductive rights 38 years. It's no surprise that I have huge concerns with the far-reaching effects of this bill. I continue to be very disturbed by the substitute amendment offered by Mr. Pitts that creates broad exemptions to a 35-year-old law known as EMTALA. The new language creates a loophole that will allow hospitals to deny emergency medical care and even a referral to emergency medical care if compliance would mean performing an abortion. This seems quite extreme to me. During our subcommittee markup on Friday, Mr. Pitts said that the language was not incidental and that it was to prevent states and pro-choice advocates from creating emergencies where there were none. To me, I don't understand this rationale. It seems absurd. I urge my colleagues to vote against this bill. Thank you, Mr. Chairman.
Thank you. Chair will recognize Mr. Stearns for, is it right, for 2 minutes.
Good morning, and thank you, Mr. Chairman. I strongly urge the adoption of the Oversight Plan. The 112th Congress is going to be one of the biggest and most consequential in recent history and memory. The major issues facing this Congress and the country: health care, EPA regulation, energy production and development, Medicare, Medicaid, the proposed regulation of the Internet, lie at the heart of the committee's jurisdiction and will represent a substantial part of the committee's actions. We have a lot of work to do, and the oversight plan before the committee demonstrates our commitment to vigorous oversight. The plan reflects feedback from each of the subcommittee chairs and with the committee minority. I believe it is a good, strong oversight plan, and I intend to carry out a substantial part of this plan in a fair, fact-based, bipartisan manner at the Subcommittee on Oversight and Investigations. Under the rules of the House, the committee is required to adopt an oversight plan for a 2-year period and submit it to the Committee on Government Reform and House Administration by February 15th. The plan includes areas in which the committee expects to conduct oversight during the 112th Congress, subject to limits on staff and resources, but does not preclude oversight or investigation of additional matters as the need arises. Mr. Chairman, the American people expect us to honestly and thoroughly engage in oversight of the agencies and departments in the committee's jurisdiction and on the most pressing issues of the American people. We will not, however, just investigate government agencies and departments. We will also look at private industry that operate within the committee's broad jurisdiction. With this oversight plan, we can accomplish this goal, and I urge adoption of the oversight plan. Yield back.
Thank you. Gentleman yields back his time. The chair will recognize the ranking member of the Oversight Subcommittee, Ms. DeGette.
Thank you very much, Mr. Chairman. Today our committee will be deliberating several measures, including H.R. 358, which has serious consequences for women's reproductive health. This extreme legislation moves beyond any attack on women's health care that I have seen during my lifetime. Under current law, no federal funds are spent on abortions. Let me say that again. Under current law and under the Affordable Health Care Act, no federal funds are spent on abortions. Under the Pitts Amendment, women will not be able to obtain legal reproductive services in the exchange with their own money. And in addition, as the ranking member said, the overly restrictive conscience clause would allow providers to simply let women die. This is too extreme. I will speak more about these matters during the markup, but at this time I'd like to say a few words about the committee's oversight plan for the 112th Congress. Mr. Chairman, I'm very pleased to be the ranking member of the Subcommittee on Oversight and Investigations. The Energy and Commerce Committee has jurisdiction over issues that are key to the public health and welfare of American families, from food safety to energy security to ensuring access to quality health care. The Oversight and Investigations Subcommittee plays an important role in overseeing laws on these and other critical issues under the committee's jurisdiction, and they shed light on where we need to have additional legislative action. I look forward to working with Subcommittee Chairman Stearns in what I hope will be an active subcommittee. Our initial conversations about oversight plans for this Congress have been positive and productive, and while I'm confident that members on my side of the aisle will have different perspectives from time to time from members on the other side on a number of subjects contained in this plan, I'm hopeful that we will find issues among these and perhaps others on which we can pursue investigations in a bipartisan manner. Thank you very much, Mr. Chairman, and I yield back.
Thank the gentlelady, and I too look forward to working with her on matters of this importance in a bipartisan way, and appreciate her attitude and as well as Mr. Stearns. At this point, we'll continue with opening statements for 1 minute on both sides. Are there members on our side? Mr. Barton, Chairman Emeritus, for 1 minute.
Thank you, Mr. Chairman. I put my entire statement in the record. I simply rise to say I support the oversight plan that you're going to offer today. I also support strongly the Protect Life Act, which was marked up at subcommittee in the last week. That's a very important bill to correct the problems of the new health care law that we passed in the last Congress, and I support passage of the other authorization bills that deal with dental emergency responders, veterinary public health, and neglected infections of Impoverished Americans Act. I yield back.
Gentleman yield back. The chair will recognize a friend from Massachusetts for 1 minute for an opening statement. Mr. Mark.
Thank you, Mr. Chairman. Mr. Waxman has already outlined the objections which I have to the legislation that is being propounded by the gentleman from Pennsylvania, Mr. Pitts. But I will just summarize by saying that his legislation will make it virtually impossible for insurance companies in the soon-to-be-created state health insurance exchanges to offer abortion coverage to women, even when they pay entirely with their own money. If a woman receives a federal subsidy to purchase insurance, she would hospitals to refuse to provide life-saving care to women who face imminent threat of death. That is, the woman is about to die. The family is saying, please save our mother. Please save my wife. Please save my sister. But the hospital can refuse to do so. I think that is wrong. And it also bans abortion coverage in all multi-state insurance plans. I think this legislation is misguided. I urge its rejection, and I yield back the balance of my time.
Chairman yields back. Are there other members on the Republican side? Our chair would recognize Ms. Blackburn for 1 minute for an opening statement.
Thank you, Mr. Chairman. I will submit my full statement, but I would just like to say that I'm very appreciative for the work that is being done on the Protect Life Act. I think after the hearings that we had last week, we know and we've heard from everybody that it gives us the confirmation of what we feared last Congress, which is PPACA will without question fund elective abortions with taxpayer dollars for the first time in decades. I am pleased that we're going to correct this error and with our Protect Life Act and apply the, and I will repeat this, the long-held standard of the Hyde Amendment. That is the long-held standard of the Hyde Amendment. Appreciate the leadership. Yield back.
Gentlelady yields back. Other members in the chair will recognize the gentlelady from California, Ms. Capps.
Thank you, Mr. Chairman. Frankly, I'm shocked that we're here today, still on course to ram through dangerous and extreme legislation. I've said it before, H.R. 358 does not create a single job, not one. Instead, this extreme legislation is an unprecedented assault on the rights of women and families everywhere to make important life decisions. Furthermore, on a day when we are talking about doing oversight on overreaching government regulations, this extreme bill would actually expand the federal government's reach into the emergency room, into the doctor's office, and into the home. while some might say this is just like the Stupak legislation we fought so hard against last year, let's be clear. This legislation is Stupak on steroids with subtle but extreme differences that could lead to women dying in a hospital emergency room without any right to a referral. I urge my colleagues to abandon this divisive effort, put the brakes on this extreme legislation, turn its focus instead to the issue of job creation to help the American people instead of harming them. I yield back.
Gentlelady yields back. Chair would recognize Dr. Gingrey for an opening statement for 1 minute.
Thank you, Mr. Chairman. As a lifelong pro-life Catholic and a practicing OB/GYN for nearly 30 years, I believe that all life is sacred. The issue of abortion is a very personal issue for me, as it is for this country and many members, if not all members on this committee. But that's not why we are here today. We're here to answer one simple question. Should Americans' tax dollars be used to fund abortions? When an elective choice can decide life and death, should the federal government be allowed to use tax dollars to pay for that choice? The Protect Life Act is a piece of legislation that seeks to set right what the last Congress got wrong, ensure that abortions are not funded by taxpayer dollars. Speaking as a father, a son, and an OB/GYN physician who's delivered over 5,200 babies, I will be voting to ensure our government does not put taxpayer dollars behind any person who seeks an elective abortion. And that's the simple crux of the issue here today. And I yield back, Mr. Chairman.
Gentleman yields back. The chair would recognize Mr. Towns from New York for 1 minute for an opening statement.
Thank you very much, Mr. Chairman. I strongly oppose the Protect Life Act. I said this during the subcommittee markup last week, and I will say it again and again and again. This bill is completely outside of the scope of what we should be talking about, and that's jobs, jobs, jobs. When I walk around my district and I see graduates of prestigious universities sitting around unemployed, I'm reminded of that fact. Nothing in this bill creates jobs. Instead, what it does is deny access to reproductive health care. It gives insurance companies new power that it does not have under current law and would allow public hospitals to deny life-saving care. I could not, in good conscience, support a bill that would do that. Let's work together to improve our economy, not dismantle existing health care options for women. I'm proud, however, to be co-leading the Dental Emergency Responders Act with Mr. Burgess. This bill, along with the two others we are considering, are common sense bipartisan measures. That's what we should be about, and understand how important it is to create jobs, not create problems.
Gentleman yields back. Chair would recognize Ms. McMorris Rogers from Washington State for an opening statement.
Thank you, Mr. Chairman. When we talk about health care coverage for our children, it is all meaningless if we are not going to protect them at the moment their lives begin. Last week we heard Administrator Jackson talk about the need to regulate carbon emissions because of the impact on our children's health and well-being. Well then, I asked my colleagues on the other side of the aisle to join us in protecting our most vulnerable children, those who cannot protect themselves. 2/3 of women polled during the health care debate, representing all parties, races, marital statuses, objected to the federal government paying for abortions. This bill heeds that call and maintains the policies that both parties have agreed upon over the last several decades. I urge my colleagues to support the Protect Life Act, and I yield back.
Gentlelady yields back. Chair would recognize the gentlelady from Illinois, Ms. Schakowsky, for 1 minute.
Let's be clear. This bill is not about protecting life. It is an extreme and reckless bill that actually endangers the health and life of women and also attacks their rights. We just heard about how we have to protect the most vulnerable. The same people who are supporting this legislation are going to vote for a $750 billion cut for a big cut in the WIC program, I guess it's million, that is going to affect women and children at birth. So are we just concerned about conception to birth, or are we concerned about children after they're born? This legislation is not just about the Hyde Amendment. We established last time that it would allow, on a basis of conscience, denial of contraception to women, that there are all kinds of provisions in this bill that would deny women their rights to reproductive health, not just to abortions. We have already banned the use of public dollars, federal dollars, for abortions. And that is clear. We are revisiting something that's already been decided, and I want to urge all my members who are really interested in protecting life to leave it up to the women to decide with their doctors, with their God, and to vote against this legislation.
Chair would recognize the gentleman from Ohio for an opening statement, Mr. Latta.
Thank you very much, Mr. Chairman. I'd ask unanimous consent that my written testimony be submitted
Without
for the record.
objection, all opening statements are made part of the record.
I thank the chairman, and also just that I want to again strongly state that I am going to be supporting the Protect Life Act, and also ask the unanimous consent to submit for the record for the full committee letter dated February 10th, 2011 from the Catholic Healthcare Partners in its support of H.R. 358. Thank you, Mr. Chairman.
Chair would recognize the gentlelady from California, Ms. Ashew, for an opening statement.
More than one gentlelady from California.
There are a lot of gentleladies
That's
from
right.
California, but you're just one of the many.
Right. Thank you, Mr. Chairman. I'm pleased to support the small bills that are being brought up for approval today, and thank the people that are involved in those efforts for bringing them forward. It really is, I think, really rather sad to hear this relitigation of pretend, in plain English. Pretend that there wasn't language in the Affordable Care Act that reflected the Hyde language. Whether someone has been pro-life or pro-choice for over 2 decades, that language has been honored in the House. But make no mistake about it, the bill that we're marking up today, which I think is really deceptively named the Protect Life Act, will play out very differently in people's lives. For a party, the Republican Party, to constantly hammer about the arm of government in people's lives, I'm stunned that you would use your arms to reach into individuals' lives, women's lives in the country, where they cannot even use their own private dollars to secure a health care policy that they wish to have. So you want to manipulate you don't want people to have access to something that they want to pay for with their own dollars. That is one hell of a stretch, and it's dangerous. It's dangerous. What would the party say if we started regulating vasectomies and what you can have and what you can't have? How would that go down? So this is, I think, bad legislation. It doesn't protect anyone or anything, and I would urge my colleagues to reject it.
Gentlelady's time has expired. Are there other members on the Republican side wishing to give an opening statement? Gentleman from Texas, Mr. Olson, is recognized for 1 minute.
Thank you, Mr. Chairman. I'm proud to be an original co-sponsor of H.R. 358, and I thank Chairman Pitts for moving this bill so promptly. The vast majority of Americans object to federal funding of abortion. Under the guise of a toothless executive order, Democrats argued that no federal funds would go towards abortion under the Affordable Care Act. However, we found out that this is simply not the case. There are known examples of abortions being funded through the Affordable Care Act. This legislation fixes this egregious flaw by preventing federal monies from going towards abortions that offer these services. When I ran for Congress in 2008, I promised the people of the 22nd Congressional District of Texas that I would do everything in my power to prevent federal funding of abortions. I ask my colleagues to support this legislation. Yield back.
Gentleman yields back. Are there other members? Chair would recognize the gentlelady from Wisconsin, Ms. Baldwin.
Thank you, Mr. Chairman. It's noteworthy that the very first bill to be marked up by this committee under its new leadership is not about jobs or strengthening our economy, but rather extreme legislation that divides Americans. Despite all the talk about jobs and deficits during the midterms, Republicans have instead put forth extreme legislation that takes away women's ability to make their own important life decisions about their reproductive health. This extreme legislation is an unprecedented display of lack of respect for American women and our safety. The bill would cut off millions of women from the private care they already have and limit the ability of a woman to get the care she needs, even if the result is a serious, permanent health condition that could shorten her life. Enough is enough. It's time for the Republican majority to respect women's choices and focus instead on restoring our economy. I urge my colleagues to oppose this extreme and intrusive legislation, and I yield back.
Gentlelady yields back. Are there further members on the Republican side wishing to give an opening statement? Mr. McKinley from West Virginia.
Thank you, Mr. Chairman. There are many things wrong with the health care bill that was passed by Congress last year. Among the most troubling was the provision that federal funds would be used to fund abortion. Even the Obama administration heard the outcry by the American public. Unfortunately, they did not listen. The President merely signed an executive order that was not strong enough to allay the concerns and fears raised by millions of Americans. Today, one of the bills we are considering will correct that inconsistency. Mr. Chairman, a minute is not enough to convey my personal feelings regarding this issue, but for me, the right to life issue is about one thing: respecting life. I believe our actions today are a means to achieve that goal. Thank you, Mr. Chairman, and I yield back my time.
Gentleman yields back. The chair recognizes the gentleman from Washington State, Mr. Inslee.
Thank you, Mr. Chair. It is regrettable that we aren't turning to job creation, instead turning to another socially divisive issue which divides us rather than unites us. But I want to point out a failure here that is becoming a pattern with the Republican majority already in a couple of weeks, and that is an effort to ignore the constitutional way of deciding things in our country that does reach a resolution of things we disagree on. Last week, this committee essentially wanted to ignore the constitutional principle that the Supreme Court decides issues of law in our country on the issue of whether or not we were going to have dirty air or clean air. The Republicans wanted to pass a bill to give us dirty air. This week, it's an effort to ignore the Supreme Court and the U.S. Constitution on a decision that does divide us, but we have a mechanism of resolving that in this country. And right now, under the current law, as we ought to take an oath to, gives a constitutional right to a woman to make this very individual private decision. This assault, I think, on the Constitution does not help us move forward as a country. We ought to be focusing on jobs. Thanks.
Gentleman's time has expired. Are there any other Republicans wishing to give an opening statement? Seeing none, I look to the Democratic side. Are there any further Democrats? Any more Democrats? The chair recognizes a gentlewoman from California, Ms. Matsui.
Thank you, Mr. Chairman. I strongly oppose H.R. 358. It's a gross overreach of the Republican majority. Access to contraceptives and other services are critical components for the health and well-being of millions of American women. Every woman should have the ability to make deeply personal and important decisions about their own bodies and whether or not to start a family. Moreover, it is their legal right, a right affirmed by the Supreme Court, to make these decisions. Congress should not be in the business of trying to deny these legal rights to Americans' women. It is my hope that this committee and its members affirms our commitment to the health and safety of America's women, and that we move beyond such relentless attacks on the woman's right to choose. With that, I yield back my time.
Gentlelady yields back. Are there any other member wishing to make an opening statement? Seeing none, Again, I'll remind all members that they can submit their opening statements as part of the record. We're now prepared to call up the bill, H.R. 525, and I ask the clerk to report.
H.R. 525, to amend the Public Health Service Act to enhance and increase the number of veterinarians.
Without objection, the first reading of this bill is dispensed with, and the bill will be open for amendment at any point. So order, are there any amendments in a bipartisan way that might be wanted to be offered at this point? Seeing none, are there any other amendments to the bill? Seeing none, the question now occurs on favorably reporting the bill. All those in favor signify by saying aye. Aye. Those opposed say no. The ayes appear to have it. The ayes have it, and the bill is favorably reported. Chair now calls up the bill H.R. 528, and I ask the clerk to report.
H.R. 528, to require the submission of a report to the Congress on parasitic disease among poor Americans.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Are there any amendments to the bill? First, the bipartisan amendments to the bill? Seeing none, are there any other amendments to the bill? Seeing none, if not, the question now occurs on favorably reporting the bill. All those in favor signify by saying aye. Aye. Those opposed, please say no. The ayes appear to have it. The ayes have it, and the bill is favorably reported. The chair now calls up the bill H.R. 570 and asks the clerk to report.
H.R. 570, to amend the Public Health Service Act to enhance the roles of dentists.
Without
and
objection,
allied dental.
the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Are there any bipartisan amendments to the bill?
Mr. Chairman.
Gentleman from California.
Strike the last word. I'm assuming that if a member wants to speak on the bill, they have an opportunity
Absolutely.
to do so at
They
this
can
point.
strike the last word, and they will be given 5 minutes
Thank
on
you, Mr.
either side as we go. Are there any amendments to the bill? Seeing none, are there any other amendments to the bill? If not, the question occurs on favorably reporting the bill. All those in favor signify by saying aye. Aye. Those opposed, please say no. The ayes appear to have it. The ayes have it. And again, the bill is reported. The chair now calls up H.R. 358 as amended and asks the clerk to report.
H.R. 358, to amend the Patient Protection and Affordable Care
Without
Act to
objection,
modify
the bill will be considered as read and open for amendment at any point. So ordered. I remind members that at our organizational meeting, I indicated I would recognize bipartisan amendments first, as I've done in the other three bills. Are there any bipartisan amendments at this point, folks ready to offer? Seeing none, are there any other amendments to the bill? If not, General, recognize the gentlewoman from California. I'm sorry, from Colorado, Ms. DeGette.
I know there's a line.
I know there's it's that red.
I move to strike the last word.
Gentlelady is recognized for 5 minutes.
Thank you very much, Mr. Chairman. Mr. Chairman, during opening statements and also ever since the subcommittee hearing on this bill, we have heard ongoing assertions over and over again that the Pitts bill is virtually the same as the Stupak amendment that was passed by the House. And also many of our colleagues on this committee have described the bill as being a virtual look-alike to the Stupak amendment, and they also say it just merely echoes the Hyde amendment. So I don't see the bill that way, and in fact, the way I see the bill is that it's much more extreme than the legislation that was considered last year, and frankly, as I said in my opening statement, it has an extreme effect on women's health. So I want to ask the council a couple of questions about this particular piece of legislation, and I would ask council if you could just answer yes or no if possible. The current bill before us on page 3, line 6, applies its rules on coverage of abortion service to any health plan. Is that correct?
Yes, Congresswoman.
And last year's Stupak amendment only applied to qualified plans, meaning plans that were part of the state exchanges. It did not apply to any completely private plans. Is that correct?
If you're referring to Section 256 of the House-passed bill, or I'm sorry, Section 265, the limitations on abortion funding relate to any health plan that receives government subsidies.
Correct. So it did not apply to completely private plans, correct? That's easy. Yes, yes or no?
I believe that's correct.
Thank you. Now, the current bill before the committee protects state laws that limit insurance coverage for abortion. Last year's Stupak amendment protected both state laws that limit coverage of abortion and state laws that recover coverage of abortion. Is that correct?
Will the gentlelady repeat that, please? I'm trying to follow and I didn't quite.
Certainly. This bill says that it protects state laws that limit insurance coverage of abortion. Last year's Stupak amendment protected both state laws that limit coverage of abortion and state laws that require coverage of abortion. In other words, the Stupak amendment said that that if a state limits coverage of abortion, then that's still allowed, or if it allows coverage of abortion. But this one does not allow states to cover abortion, correct?
The section that you're referring to was in the underlying House bill, not in the amendment that Mr.
Okay, but what is the coverage?
The House-passed bill related to preemption of state laws regarding the prohibition or requirement of.
Correct. So as I said, this is broader than the Stupak amendment because this bill says that that state laws that require coverage of abortion are no longer allowed. Correct? Or not protected? Are not protected.
The legislation does not speak to whether the requirement of coverage of abortion is protected or not. The legislation before us today just speaks to the requirement on
Stupak does both, and this only does one, correct?
The underlying House bill last year did.
Yes. Okay, thank you. Now, the bill before us creates a new federal private right of action. This one isn't for patients, it's for providers that assert a conscience objection to abortion. Last year's Stupak amendment did not contain any private right of action. Is that correct?
That is correct.
Thank you. Now, the bill before the committee today strikes the limitations of law to abortion services in all the places it appears in the law. The result is protecting state laws on other topics. Last year's Congress's Stupak amendment did not make this change, and it limited the refusal rights to abortion services. Is that correct?
Mr. Chairman, I ask unanimous consent that the gentlelady from Colorado be given another 2 minutes. She's waited a long time for some of the answers.
Is there objection?
Up her time.
Hearing none, the gentlelady is recognized for an additional 2 minutes. I can get it.
Yeah,
So
yes or no?
Under the bill last year, as it relates to preemption of state laws, it did not limit it to only abortion.
So the answer is yes.
However,
Correct?
under federal federal laws, it was open to things beyond abortion.
Right, but this goes beyond the Stupak Amendment from last year, right?
As it relates to the preemption of state laws.
Yes. Okay. Now, the bill before the committee today creates an exception to the requirements of EMTALA regarding emergency care must be complied with. Last Congress's Stupak Amendment did not make that change. It didn't even amend EMTALA, that section of EMTALA at all. Is that correct?
The underlying bill today does not amend EMTALA.
Gentlelady, yield to me on that. I think that's an incorrect statement because he's saying the underlying law did not, but the way that his is drafted would have the impact of changing EMTALA in a practical matter.
Right. The ranking member is correct. It amends the Affordable Care Act, correct?
Correct, but it doesn't change the requirements of EMTALA.
The gentlelady would yield to me. It doesn't change the underlying EMTALA law, but it changes the bill from last year, which means the impact of the EMTALA law is not the same.
Thank you. Yeah, I'm just going to go on. I do have an amendment at the desk, Mr. Chairman. I don't know if it's appropriate now to offer it or not, but if so, I would offer it.
Yeah, does the gentlelady seek recognition to offer the
Yes,
amendment?
yes, Mr. Chairman, I do.
The gentlelady's amendment, the clerk will read the title of the amendment and circulate the amendment to the members.
Amendment to H.R. 358 offered by Ms. DeGette.
Without objection, the amendment is considered as read, and the gentlelady is recognized for 5 minutes to speak about her amendment.
Thank you. Mercifully, I won't speak for 5 minutes, Mr. Chairman, but I want to talk about what this amendment does. What it does is it helps define what access to means. It makes sure that the phrase access to does not include providing information to consumers, telling them the insurance options available, and whether they include or do not include comprehensive reproductive services, and providing information to consumers about the location where they can receive comprehensive reproductive services. So given Republicans and Democrats' commitment to transparency in the healthcare marketplace, with that, I will yield back.
Gentlelady yields back her time. Are there other members wishing to speak on the amendment? Seeing none, Chair would recognize gentleman from Louisiana, Mr. Scalise, for 5 minutes.
Thank you, Mr. Chairman. I rise in objection to the amendment, and I think it's important to note that this would actually force a doctor who, under conscience, is opposed to abortion to then have to help facilitate an abortion that he's opposed to. Not only do I think that's not a moral position that we should be forcing a doctor to be put into, but the Catholic Medical Association, which is the largest association of Catholic physicians in the United States, has actually sent a letter opposing any type of language that would weaken conscience clauses. And clearly this would not only weaken it, but it would force the doctor, put the doctor in a position of having to help facilitate abortion even though the doctor is opposed to it morally. I think this completely goes against the intention of what we're trying to do with the Pitts legislation. I strongly oppose it.
Will the gentleman yield?
And I would yield back the balance of my time.
Mr. Chairman.
Gentleman from California, Mr. Waxman.
I first of all yield to Ms. DeGette.
Thank you.
I think it's helpful for us to yield to each other so we can get the issues clarified. So
the only thing I will say is this amendment does absolutely nothing to force doctors to provide services. It just simply gives a definition of the access of information, which it seems to me we would want everybody to have access to all appropriate medical information, what their insurance covers and so on and so forth. There's nothing in here that forces doctors to do anything that they don't have to do already.
As I see this language in your amendment, you're saying that access, where where we're talking about the conscience clause, shouldn't preclude information about abortion services by others, including the provision of information regarding the availability of or limitations on insurance coverage, so that I suppose that would mean a doctor can say your insurance does not cover abortion services. The doctor or others who provide medical care could say, but if you go somewhere else, the abortion services are available, and then it will or will not be covered. So this is basically allowing information to be given. So the question is it a violation of someone's conscience to give accurate information to someone who asks for it? And I think this amendment's appropriate. It's not forcing anybody to do anything other than to give accurate information, such as, I don't perform abortions, this institution will not perform abortions, your insurance does not cover abortions, and if you want more information, you have to go somewhere else for it, and there's an identification where they might go. Is that the correct understanding?
That is correct.
Will the gentleman yield?
I'd be happy to. Who's seeking me to yield?
Yeah.
Yes, gentleman.
Way down here in the corner.
Okay, the man in the corner.
Now, I was with you all the way up until the very end.
Yes.
Because, okay, I don't cover it, this hospital doesn't do it, and as far as I know, your insurance doesn't cover it. On the other hand, I can already imagine there being a form legislated, a checklist, if you will, which effectively amounts to a referral. I'm a practicing physician, I still teach, and so I know how this works. Sometimes that's appropriate. Sometimes you want to make sure that there's a checklist, and the legislature mandates that. But I can tell you that there's going to be someone who is, on the basis of morality, his or her morality, opposes abortion. They're going to be given a checklist. And it says, if you don't document that you've done this, then you're busted. And I don't think, frankly, that's where we want to be.
If I could reclaim my time, I don't think that you're required to give this information, but if you do give the information, you're not violating the underlying statute. And I think that's the important point. And let me ask the author if that's correct understanding.
That's exactly correct.
So did somebody who doesn't want to give the information out required to give out the information?
Thank you for yielding. No, it's just as I said. It doesn't change people's obligations that they would have under current law, but it simply says under the underlying law, this would not preclude them from giving that information to somebody.
And I think that's important because let's say somebody goes into a hospital, they talk to the person at the admissions desk, they say that I want to be admitted because I would like to have termination of my pregnancy. The person there could say, well, we don't perform abortions here. Dr. So-and-so won't do it. And your insurance, as I look at it, doesn't cover it. But if you go to Hospital Y, you could talk to them about it. A lot of people go there to get information. That person could be fired under the statute that's being proposed, under the bill. And what the DeGette amendment is saying is that this should not be a reason to discriminate against employees who might give this information if others in the hospital might not, in good conscience, want to perform the service.
Will the gentleman yield?
I'd be pleased to yield, but who's asking me to yield?
Again, way down here in the corner.
Okay.
This is Cassidy. So if a Catholic institution has as a mission to protect life, and there is someone who is employed by them and theoretically is on the same team and is to reflect that mission, and the Catholic institution is, as part of their kind of same instinct that leads to them to set up a hospital and treat people, leads them to instruct their employees not to make effectively referrals or be providers of information. I gather that that
policy, reclaiming my time, which is just about out, that policy could be the policy of the hospital, but if someone gives that information, they should not be penalized for giving that information. And I think it gets to be beyond the conscience of the institution to be so narrow in their ability to not provide the service.
Gentleman's time has expired. Is there further discussion on the amendment?
Yes.
Gentleman, or Chair will recognize Mr. Cassidy. And then
Just to continue that, actually, I understand that completely. It would be as if the person in poison control said, listen, I don't want you taking poisonous mushrooms. If you really want to kill yourself, there's a more effective way. So I think that there is in a mission-driven organization a certain ethic that each employee is expected to represent. Now, what you say sounds very reasonable until it comes down to what is the mission of the institution. And if you have 1,000 employees and all 1,000 decide, well, we accept the admission or we don't accept the admission, and we're going to go our own way, then you cease to have an institution, you just have a collection of individuals. So I think what this amendment does, as I understand it, would be to allow the individual to abnegate, if you will, their responsibility to reflect the institution's mission. I yield back.
Gentlemen, yield.
No, gentlemen, yield before you yield back.
I will yield, yes.
Who did you yield to?
Whoever yelled first.
No, I want to, and Chairman Waxman, so if you pick Mr. Cassidy first.
I'm sorry, I was...
Myself or Chairman Waxman?
Mr. Shimkus and then Mr. Waxman.
All right. Thank you. I just want to point, the issue of what many of us fear that happened in the last health care debate was an attempt to continue to federalize all health insurance issues. This can be done through the states. States are regulated, insurance is regulated by the states. So if your state wants to impose this new requirement, then go for it. But for those of us who continue to want to keep any semblance of a federal system of government left, that's why we would want to oppose this amendment, to keep the requirements of insurance regulation by the state. And I'll yield back to Mr. Cassidy.
Mr. Cassidy, if you yield to me.
I do yield to Mr. Waxman.
The provision in the bill says, nothing in this act shall be construed to require any health plan to provide coverage of or access to abortion services. I don't think we have any definition of access to, and so the DeGette amendment's defining access, and they're saying access to does not include the provision of factually accurate information about abortion services, including the provision of information regarding the availability or limitations on insurance coverage, or the location of available abortion services, and the procedural requirements applicable to such coverage or services. So let's go down to this example. At a hospital where they won't provide services, someone is asked, well, I want to know where I can get these services. And they say, it is not our policy to provide the services or to give you information about it. If you want, look it up in the yellow pages. And the person then looks it up in the yellow pages. I think that employee could be fired for giving access to that information. So we're trying to limit and define what access means. And then we would permit, under the DeGette amendment, people to say they won't provide abortions, insurance coverage won't provide it, and then the location of available abortion services.
Reclaiming my time, really, though, I mean, it's being repackaged in a more reasonable way yet, but it really sounds like you're giving license to an individual to reject the mission of a healthcare institution, number one. And number two, I mean, if what you've just given us two different definitions of access. And so clearly there's an elasticity here, which is frankly why we on this side are concerned about it. You first say, well, wait a second, you can actually go here and get it. Okay, that's one level of information. The other is we don't give it to you, but you can check out the yellow pages. That is another level of information. And so there's an elasticity here, which frankly, an amorphous aspect of the concern, and which is why I would oppose the amendment.
Will gentleman yield?
Will gentleman yield?
I will yield to Dr. Burgess.
Well, just as a practical matter, when you get privileges at a Catholic institution, their mission statement is quite clear, and you voluntarily either agree to comply or not comply. No one forces you to do it, no state law, no federal law. You agree to do it as a matter of conscience. You can either accept or reject their mission, and this amendment to me seems that it would abrogate that freedom of choice. So I would be opposed to the amendment, and I'll yield back to the gentleman.
Gentleman, yield back his time.
I have 13 seconds. You can have it back.
Yeah, I have got it back. I recognize the gentlelady from California, Ms. Capps, for 5 minutes to discuss the amendment.
Thank you very much, Mr. Chairman. Now, I think, from my opinion, this discussion that we're having just underscores the vagueness in the underlying bill by lack of a definition of access to. And the reason I support the DeGette amendment is that we need clarification. You know, the underlying legislation continues to be referred to by our friends on the other side as just like the Stupak language we debated last year. But in this amendment, which our colleague, Mr. DeGette, has introduced, there's yet another place where supporters of this bill are determined to go way beyond Stupak to promote an even more extreme agenda. I call it a straitjacket, prohibiting any requirement to provide access to abortion services. In many instances, the Catholic hospital that's been described, and we can all think of some in our districts, the one I'm thinking of is the only place where health care is provided in a primary setting like a hospital from miles around. So the ability to really access that information people go to the hospital to do that. This broad language would prohibit states and state-based health insurance exchanges from ensuring that women even get information about the health care coverages that are available to them. Limiting access to information about the availability of plans that cover full reproductive care, or similarly, it could limit access to information about lack of availability of health plans that cover full reproductive care. Access could be interpreted to include a plan brochure, a referral, an email that gives someone information about where you can get a full range of services, even a phone book, as Mr. Waxman just said. Our tricky healthcare system is confusing at best. The potential unknowns are clear, but the true implications of this bill as written are not unclear. It's clear that supporters want to restrict the rights of women to their full range of women's health services guaranteed in the Constitution, but this language would restrict the rights of women to even simple information. So I'm definitely supporting this amendment as a way of clarifying what access means, and now I will yield to the author of the legislation.
I thank the gentlelady for yielding. Mr. Cassidy was exactly right. If you look at the way this section is worded, this section was not in the Stupak amendment last year, and on page 3 of the bill, lines 4 through 7, it says nothing in this act or any amendment made by this act shall be construed to require any health care plan to provide coverage of or access to abortion services. That's all it says. So some provider could interpret it lots of different ways. That's what I'm trying to say. What would it mean? Would it mean transportation by an ambulance? Would it mean referral by a doctor to a hospital? Would it mean information given to a patient? As Mr. Waxman said, you could have a hospital where the person at the front desk said, well, go look at the yellow pages, and the hospital would deem that that was beyond the conscience clause of the hospital and fire that employee. So that's what I'm trying to do is define what access, coverage of or access to abortion services means. Nothing more, nothing less. What we're trying to say is this is what it means to provide access if you're going to do it. That's all we're trying to do is clarify this so that the providers, the hospitals, and the patients all know what they're getting. And that's all it is. I thank the gentlelady for yielding.
Gentlelady yield back her time? Okay, gentlelady yields back her time. Is there further discussion on the amendment? If not, the gentlelady asks for a recorded vote. Those in favor of the amendment will be recorded as saying aye. Those opposed say no. The clerk will call the roll.
Mr. Barton.
No.
Mr. Stearns.
No.
Mr. Stearns, no. Mr. Whitfield. No. Mr. Whitfield, no. Mr. Shimkus. No. Mr. Shimkus, no. Mr. Pitts. No. Mr. Pitts, no. Mrs. Bono-Mack. Mrs. Bono-Mack, no. Mr. Walden. Mr. Walden, no. Mr. Terry. No. Mr. Terry, no. Mr. Rogers. No. Mr. Rogers, no. Mrs. Myrick. No. Mrs. Myrick, no. Mr. Sullivan. No. Mr. Sullivan, no. Mr. Murphy. Mr. Murphy, no. Mr. Burgess? Mr. Burgess, no. Mrs. Blackburn? Mr. Bilbray? No. Mr. Bilbray, no. Mr. Bass? Mr. Bass, no. Mr. Gingrey? Mr. Gingrey, no. Mr. Scalise? Mr. Scalise, no. Mr. Latta? Mr. Latta, no. Mrs. McMorris-Rogers? Mrs. McMorris-Rogers, no. Mr. Harper? Mr. Harper, no. Mr. Lance? Mr. Lance, no. Mr. Cassidy? Mr. Cassidy, no. Mr. Guthrie? Mr. Guthrie, no. Mr. Olson? Mr. Olson, no. Mr. McKinley? Mr. McKinley, no. Mr. Gardner? Mr. Gardner, no. Mr. Pompeo? Mr. Pompeo, no. Mr. Kinzinger? Mr. Kinzinger, no. Mr. Griffith? Mr. Griffith, no. Mr. Waxman? Mr. Waxman, aye. Mr. Dingell? Mr. Markey? Mr. Markey, aye. Mr. Towns?
Aye.
Mr. Towns, aye. Mr. Pallone? Mr. Pallone, aye. Mr. Rush? Ms. Eshoo? Ms. Eshoo, aye. Mr. Engel? Mr. Engel, aye. Mr. Green? Ms. DeGette? Ms. DeGette, aye. Mrs. Capps? Mrs. Capps, aye. Mr. Doyle? Mr. Doyle, aye. Ms. Harmon? Ms. Schakowsky? Ms. Schakowsky, aye. Mr. Gonzalez? Mr. Inslee? Mr. Inslee, aye. Ms. Baldwin? Ms. Baldwin, aye. Mr. Ross? Mr. Weiner? Mr. Weiner, aye. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, aye. Mr. Barrow? Mr. Barrow, aye. Ms. Matsui? Ms. Matsui, aye. Mr. Upton?
Votes no.
Mr. Upton, no.
Are there members wishing to cast their vote? Ms. Blackburn?
Mrs. Blackburn, no.
Mr. Ross?
Mr. Ross, no.
Mr. Green?
Mr. Green, aye.
Are there other members wishing to cast their vote? Seeing none, the clerk will report the results.
Mr. Chairman, 17 ayes, 32 nays.
The DeGette amendment is not adopted. For what purpose does the gentlelady from Wisconsin seek recognition?
Mr. Chairman, I move to strike the requisite number of words.
Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. I have some matters that I would like to ask Council to clarify before we move forward with the markup. Given the serious implications of the ambiguity of the language about the reach of the conscience rights, it's critical to ensure that we know how this language is going to be applied. In statutory interpretation, courts will always interpret an amendment to a statute as making a difference to the underlying meaning of that statute. So, Council, I would refer you to page 6 of the committee print, lines 6 to 10. Current law is entitled Application of State and Federal Laws Regarding Abortion and No Preemption of State Laws Regarding Abortion. But the bill at these lines strikes the words regarding abortion in both of those sections. So, Council, would I be correct if I said that the effect of this is that the provisions are no longer strictly limited to abortion, since we're striking the words regarding abortion?
The first two provisions you referred to were the headings of the section. The Section C1 of PPACA.
Indeed, you are correct. These are headings. But we are still amending underlying statute, and amendments give meaning to that. So would I be correct if I said the effect of this is that the provisions are no longer strictly limited to abortion?
The underlying amendment does add conscience protections into 1303C1.
Okay.
Those conscience protections mirror what is in 1303C2 related to federal law.
Okay, so please take a look then on the same page, lines 13 and 14 of the committee print. In that section, the bill adds the phrase, protecting conscience rights, to the list of items in state laws that are not preempted. Counsel, could the term conscience rights include anything other than abortion, given the previous section we discussed?
Yes, it could be, but the section that you're referring to is just the effect that the law is having on state laws.
Correct.
It does not preempt them. It just says they're not
correct.
preempted.
So, counsel, could conscience rights be interpreted in certain states to include refusing to provide information about the morning after pill to a rape victim? Could it?
Yes, it could.
Counsel, could conscience rights be interpreted to include refusing to provide fertility treatments, including artificial insemination, to a lesbian on the basis of her sexual orientation?
Yes, it could.
How about refusal to provide fertility treatment to a single woman on the basis of her marital status?
If the state law provided for that.
So the answer is yes, it could.
If the state law provided for that. Yes.
Counsel, could conscience rights be interpreted to include refusing to provide mental health counseling to a gay teenager contemplating suicide because his family or community is not supportive of his sexual orientation?
Again, it would depend on what the state law, if the
But
state
it
law
could.
precluded that, then it would protect the state law.
Counsel, could conscience rights be interpreted to override the new HHS rule that guarantees hospital visitation rights for same-sex couples?
The underlying statute relates to federal law and conscience rights. So I guess in 1303C2 regarding federal law, we're saying that the Protect Life Act does not have any effect on federal law. And I guess you were referring to HHS regulations, which would be federal law.
Okay, counsel, could conscience rights be interpreted to undo the essential benefits package under health care reform? Can some health plans assert their conscience does not permit them to cover contraception and or family planning?
The essential benefits plan is a federal law. What we're
Which will
talking
be
about,
implemented by states.
and will be regulated by the Secretary of HHS. What Section 1303C1 refers to is the non-preemption of state laws. And in that instance, I believe the state law would be in conflict with the federal law.
Counsel, could this provision, the conscience rights provision, be interpreted to allow denial of maternity care for a woman living with HIV?
Again, this is determinative of what the state law is.
Correct, but could it be?
If a state had such a law.
Thank you, counsel.
Gentlelady's time has expired. Chair would recognize the gentlewoman from Illinois for what purpose?
I have an amendment at the desk.
Clerk will report the title of the amendment.
Amendment offered by Ms. Schakowsky of Illinois.
Without objection, the reading of the amendment is dispensed with. The clerks will disperse the amendments. The gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. My amendment follows on the heels of the questioning of counsel that was just conducted by Congresswoman Baldwin. What my amendment does is reinstate the words regarding abortion that are contained in the current law adds the phrase regarding abortion to the vague and undefined term conscience rights. There has been from the start of this debate a focus on abortion, that this is to make sure that federal dollars don't go to fund abortion, that it clarifies the Stupak amendment. As has been made perfectly clear, it is obvious that the Pitts language, whether intentionally or not, is ambiguous about the reach of those so-called conscience rights. And so what my amendment does is make very clear that these provisions, as did the underlying bill, are solely about abortion. My amendment would prevent conscience rights, a vague and undefined term, from being interpreted to include conscience objections to contraception, HIV testing, mental health or substance abuse counseling, the rights of gays and lesbians. The reason that I am concerned about the ambiguous reach of conscience rights in H.R. 358 is because we know that some medical providers in Illinois have relied on a broad interpretation of the term to do the following: to refuse to provide insurance payments for not only abortion but also contraception, refuse to dispense medications at pharmacies, and refuse to refer or transfer prescriptions even to go to another pharmacy, refuse to provide information about referrals for condoms for patients concerned about protecting themselves from HIV. These are real life situations. They do not have to do with abortion. This is an expansion of the current law and very different from what the sponsor of the legislation claims is the purpose of this bill. So when you say that H.R. 358 is simply codifying the Hyde Amendment or extending the status quo, that isn't the case. The ambiguity surrounding the reach of so-called conscience rights is just one example of how this legislation goes beyond current law. So I would urge my colleagues to limit the scope of their legislation to what they said it was about, and not to expand these conscience rights to include things that don't relate to abortion, but in fact go far to deal with issues like the rights of gay and lesbian couples, of single adults. Then I would suggest that you reinsert the language of regarding abortion on page 6 of the legislation. And I yield back. Gentleman from, did you want, Jay?
Gentlelady yields back.
I yield back, yes.
Gentleman from Illinois, Mr. Shimkus.
Thank you, Mr. Chairman, to speak against the amendment.
Gentleman is recognized for 5 minutes.
Thank you. I have great respect for my friend and colleague from Chicagoland. I'm a downstater. As I mentioned in the subcommittee hearing, it shows the great diversity of a state. Many of us come from states, big urban areas, large rural areas, different values, different opinions. This is an Illinois issue in which the legislature has addressed. And this is about prescribing and really, as I was corrected last time, dispensing of abortifacients, RU 486. When in Illinois, many pharmacists did not want to be partners to abortion. And they didn't want to be mandated to dispensing the abortifacient RU 486. Obviously, in a great, huge state like Illinois, a great diversity of opinion, great battles in the General Assembly, the law was established to provide a conscience clause for the pharmacists in dispensing. It's curious that we now at the federal level, the macro, big federal level, want to determine what should be the conscience of the individual and determine what that is. I mean, not only do we want to get involved in the state activities, now we're trying to get involved in the individual healthcare providers decision-making process as what is morally unacceptable to them. And Illinois, again, huge state, great diversity, reconciled it through the General Assembly. I would plead with my colleagues to support states' rights and the ability of the states to make this determination as the state of Illinois did in protecting conscience rights, and I yield back the balance of my time.
Gentleman yielded it back his time. The chair will recognize the gentlelady from Wisconsin for 5 minutes on the amendment.
Thank you, Mr. Chairman. I speak in strong support of Congresswoman Schakowsky's amendment. If there's one thing that our hearings and subcommittee markup have demonstrated, it's that this extreme and intrusive bill has serious consequences, including limiting access to health care for millions of Americans. As my earlier questioning revealed, this amendment is needed in order to ensure that the undefined term conscience rights applies only to abortion. Intentionally or unintentionally, the Pitts language is notably ambiguous about the reach of conscience rights. The implications of this ambiguity are tremendous, and I'm very concerned that this bill before us today could undermine care provided to lesbian, gay, bisexual, and transgender individuals. This bill raises several important questions. Could the language allow a healthcare institution or medical professional to refuse to provide care for LGBT Americans? Could it allow a hospital or its staff to refuse visitation to a partner of a gay or lesbian patient? Mr. Chairman, I'd like to share with you a case decided by the California Supreme Court in 2008. Guadalupe Benitez, a lesbian, brought suit against the North Coast Women's Care, a medical clinic that was treating her infertility. 2 doctors at the clinic declined to perform artificial insemination for Ms. Benitez, claiming religious objections because she is a lesbian. The Supreme Court held that the First Amendment rights to free exercise of religion does not guarantee a right to deny fertility treatment to lesbian patients. But my concern is that under the ambiguous language of the Pitts bill, more patients like Ms. Benitez will be denied care. This amendment could also open the door for denial of care for LGBT individuals seeking mental health treatment. In Michigan, a graduate-level counseling student refused to counsel a gay man about a same-sex relationship because she believes homosexuality is immoral and being gay is a choice, and therefore could not in good conscience counsel that client. And Mr. Chairman, perhaps a grown man or woman has the ability to seek counseling elsewhere if turned away because of prejudice. But my colleagues know that we are facing a harrowing surge of teen suicides in the LGBT community. It is unconscionable to me to think that our young people might be turned away from the help that they need and deserve because of the bill that we are considering today. Furthermore, this bill could have serious implications on hospital visitation. As you know, President Obama issued a presidential memorandum last April that will ensure LGBT Americans receive equal treatment and compassionate care at U.S. hospitals by allowing visitors designated by the patient without regard to sexual orientation or gender identity. It is critical that we ask how this bill would impact this new rule. Would a specific doctor, nurse, or other medical professional be allowed to pass over dealing with an LGBT patient and his or her family to a colleague if he or she had some sort of moral objection? Is your intent to send us back to the dark ages where same-sex partners are separated from each other during their time of desperate need because of a staff member's conscience rights? Mr. Chairman, while I oppose this extreme bill for many reasons, I believe that the least that we can do is ensure that the conscience rights language is limited. This bill is supposed to be about abortion. Let's not make it about opening the door to denying any form of health care to Americans. I urge my colleagues to support this amendment.
Does the gentlelady yield back her time? Further discussion on the amendment. Dr. Gingrich.
Mr. Chairman, not discussion on the amendment, but a question of counsel. Counsel, referencing the Joint Committee print of the Patient Protection and Affordable Care Act, Section 1303C2. The question is, does the preemptions contained in this section of the Patient Protection and Affordable Care Act apply only to abortions?
No, the section regarding the effect on federal law is broadly applied to all conscience protections.
Okay. Thank you.
Does the gentleman yield?
Does the gentleman yield back his time? Gentleman yields back his time. Is there further discussion on the amendment? The gentleman from New Jersey, Mr. Pallone, is recognized for 5 minutes.
Mr. Chairman, I'm really disturbed by the debate. I support this amendment. I think this amendment is crucial because of what we're hearing today in the debate. My colleagues on the other side of the aisle repeatedly said in the subcommittee hearing they were just trying to prevent the government from funding abortions. But it's clear, based on questions that have been posed by members on both sides of the aisle at this point, that this is much broader. And you're going against women's health, and you're going after more than just government funding of abortion. And it's just another indication of why this bill is too extreme. It's overreaching. I'd go so far as to say now it seems like it's intentionally overreaching. Some of the members are commenting on the other side and suggesting that this is what they had in mind from the beginning. So this amendment is really crucial if we're going to rein in this overreaching and not just open up the possibility of really restricting women's health and even beyond women's health. I yield back the balance of, I yield to the gentlewoman or the gentleman from Washington.
This morning I woke up and I saw a headline. It said, Republican War on Contraception. And I thought, well, that has to be an overstatement. Surely in today's age, we wouldn't have one of the major parties with a noble tradition really taking action to prevent women and men from getting contraceptive services. But this discussion has shown this was not an accident. It was not an incidental foul-up by some drafter. It is an intent to reduce the availability of contraceptive services in America. Not abortion, but emergency contraception. I was regional director of HHS when emergency contraception had its first sort of trials out in Seattle areas in the mid-90s. It has now been proven to be extremely effective, extremely safe, and extremely acceptable to the American people. And yet, this appears to be a conscious effort to prevent people from getting access to emergency contraception. Now, I understand conscience clauses, but where does this stop? Where does this stop? And we do have people who are good Americans, who have good consciences, who believe that blood transfusions are not within the Almighty's plan. But we don't allow them to deny people blood when they go to the emergency room. And we should not allow pharmacists or others to deny people contraceptive services in this country at this stage under this Constitution. And you want to talk about a conscience clause? How about the oath we've all taken to the U.S. Constitution? And the U.S. Constitution, according to the only organ we have to interpret it, the Supreme Court, has said men and women have a privacy right in regard to these services in Griswold versus Connecticut. And we took an oath to that, all of us. And we have different views about our personal lives. But we ought to share the recognition that this is a constitutional right. And this is a conscious, willful effort. And maybe that headline wasn't so far off the case. So I urge us to pass this amendment. Let's protect emergency contraception and our respect for people's rights. Thank you. And I'll yield to Ms. Schakowsky.
Also, I want to be very clear, too, that the section that I'm amending clearly has to do with abortion. However, I want to make sure we all heard the answer to Mr. Gingry's question. You said, does the use of the word conscience rights refer just to abortions? And the answer, without equivocation, was no. I am trying to clarify that section to make sure that it refers just to the issue of abortion, as has been stated over and over again.
If there's time, I yield to Ms. Harmon if she wants the 40 minutes or take your own time.
Seconds.
All right,
Seconds.
I'll yield back.
Gentleman yields back his time. Further discussion on the amendment.
Mr. Chairman, thank you. Again, to council, referring back to Ms. Baldwin's hypotheticals, the points she listed, could the implications and scenarios cited happen because of the Protect Life Act? Or would states actually need to pass or have a law first?
The Protect Life Act just protects against the preemption of state laws regarding certain conscience rights. So in those scenarios, a state would have to pass a law that would allow for someone to implicate their conscience rights regarding any of the scenarios that she mentioned. So yes, they would have to pass a state law before those scenarios would take place.
Great.
Would gentlemen yield?
Gentlemen
yield, Mr. Gingrey, behind you.
Yes, I will yield to the gentleman from Illinois.
Thank you. Again, emergency contraceptive, as my friend from Washington State was defining, I'm assuming is an abortifacient, RU 486, which does, no, it doesn't? So define for me. It's an abortifacient.
The gentleman yield.
I'd be happy to.
RU 486 is a drug-induced abortion.
Right.
The morning after pill is a birth control pill that prevents pregnancy. They're two totally different things.
Well, I would go back to the Illinois issue of depriving the state who's made a decision on a conscious clause for pharmacists who do not want to support abortion through prescribing or dispensing an abortifacient drug. That's what Illinois decided through state law.
But
and I'm not finished.
Okay.
And as my friend from New York, who we did talk about, and there'll be issues on the constitutionality, and we should have the constitutionality of when life begins and when life is protected. But for folks to go down the ride of the rights and privileges of citizens of this country and the unborn not having the rights to be deprived of and being deprived of life through abortion, that's where we stand firm.
Exactly.
So the issue in Illinois is simple, as I said earlier. And I didn't want to. The Illinois General Assembly had this debate. Pharmacists said, we have a moral objection to be being forced to dispense an abortifacient. They went, and I will, and they went to the General Assembly. The law was passed to protect them. What we want to do is protect the rights of states and have that not being overridden by federal law. And I would yield to my colleague from Illinois.
Thank you. You're acting as if this amendment that says reinstating the word regarding abortion would somehow negate Illinois law or conscience on anything. It does not. It only, to the extent that it would relate to abortion. So if you argue that it's an abortifacient, then that's another matter. But
and that's including claiming my time, and I'll bounce back.
But
that's the issue.
This does not preempt state law. This says this is only conscience regarding abortion because that's what this bill is about.
And many of us feel that abortifacient is abortion, and pharmacists do not want to be forced to prescribe that. And that's what our issue was in the state of Illinois, and that's what our General Assembly...
And this legislation would relate to that.
And we
this
don't
legislation would relate to that.
And I disagree. So that's why I would ask. It's my time. That's why I would continue to ask my colleagues and part of this debate to protect state law, what's been decided by the Illinois General Assembly, with which much debate, and the pharmacists who have a conscience and want to. And this amendment, we feel, would deprive the state and our pharmacists from being able to deny abortifacients based upon
That's not,
our
it's just not the case.
I believe it is. My friend, Mr. Weiner, you know, no, we don't have enough time for you. I'll yield back my time.
Chairman yields, actually it's Dr. Gingrich's time, he yields back his time. Would recognize the gentlelady from California, Ms. Harmon.
Thank you, Mr. Chairman. This may be my last full committee markup before I resign my seat in a couple of weeks, and I want to thank you and the ranking member and all of our colleagues for years and years and years of partnership and occasionally a few scratchy moments, but thank you all for your friendship and for your service. I have enjoyed, particularly, Mr. Chairman, working with you on a number of issues, working very closely with you to co-author legislation and to promote causes in which we both believe. I have to say I regret that the first markup of this committee under your leadership is on this subject, a subject which we painfully addressed during health care markup last year and I thought resolved in a way that was not fully satisfactory to anyone, but we resolved it. And here we are back again in the morass. As a woman and a mother and a grandmother, this issue goes to the core of my own moral code. I respect the right of any woman or man to oppose my views, but in return I expect those who oppose my views to respect my views. I believe that abortion should be safe and rare, but that a woman's constitutional right to privacy as articulated in Roe v. Wade is inviolable. And as we get more deeply into issues like this amendment, it's very clear that, at least to me, that we are going into territory that will hurt a woman's right to choose as protected under the Constitution and in Roe v. Wade. I would like the record to show that had I been present a bit earlier, I would have strongly supported the DeGette amendment, and I would urge us, as the debate proceeds this morning, to try to be as respectful as possible, but I would hope to try to put this issue aside and proceed with the compromise we reached very carefully and painfully last year and leave that undisturbed in this new Congress. Again, I thank you and my colleagues for enormous friendship, which I hope will continue. And I say to my pals over here on this side of the aisle, I may be leaving Congress, but I am strongly with you always. Thank you. Sorry. Yes, I have 2 minutes left, and I would yield to my colleague from California.
And that gives me a chance to say how much we're going to miss our dear California colleague. And she's not going very far away, but she's going to leave Congress. And you contributed a great deal, not solely the legislation you did with Mr. Upton, but adding enormous weight and value to your constituents in California. I want to underscore that also find it very much a dismaying fact that we in this committee with such a noble agenda and tradition are beginning our new Congress through new leadership on this very divisive issue, which and I believe this conversation regarding Ms. Schakowsky's amendment is so critically important as it regards to the rights of Americans and what we stand up for when we speak of conscience. And it is clear from the questioning that happened in the markup in the subcommittee on Friday, questions of counsel and questions of counsel today, clarified on the other side with counsel that this amendment, which seeks to restrict the discussion solely to the topic of abortion, which is what the bill is about, actually has an unintended or perhaps intended consequence of reaching far into the rights of not just women, but people in terms of conscience. And I want us to be mindful of that. This common sense amendment is what we should do to clarify the role that we have in this committee, but also what the health care law intended under the SPAC provision that became the status quo law that was a part of health care in the Reform Act that is now law. And we want to make sure that people have access to health care where their states allow provisions, that there not be a straitjacket put on employees of a hospital where the rights for abortion have been restricted, but the rights for access to care should still be allowed. And that's why this clarifying amendment, along with the one that was proposed by Ms. DeGette, are critically important for us to continue. So I strongly support the Schakowsky amendment. I yield back.
And ladies, time has expired. Are there other members wishing to speak on the amendment? Seeing none, I think we're prepared to vote on the amendment. All those in favor say aye. All those say no. Call is
Mr. Barton. Mr. Stearns. Stearns, no. Mr. Whitfield. Mr. Whitfield, no. Mr. No. Eric, Mr. Murphy. Mr. No. Mr. Burgess, Mr. No. Mr. Ray, no. Fast. Fast. Angry. Mr. No. Mr. Bliss. No. Mr. Watt. Mr. Watt. Chris Rogers. Mr. Morris. No. Mr. Lance. Nance. Mr. Guthrie. Mr. Guthrie, no. Mr. Olson. Mr. Olson, no. Mr. McKinley, no. Mr. Pompeo, no. Mr. Kinzinger, no. No. Waxman, Mr. Dingle. Mr. Markey. Markey. Jones, aye. Mr. Ms. Chu. Mr. Green. Cat. Ms. Harn.
public.
Not under G, but if there's a federal law that already does so, that...
And my last question, if a physician performs an abortion for a rape victim at a private clinic under the non-discrimination section, is he or she protected from being fired from a public hospital?
Again, not under G, but other federal law applies.
Okay, so the answer is no. Thank you. Thank you, Mr. Chairman.
Gentleman's time is expired. Are there further amendments?
Yes,
to the bill?
Mr. Chairman. I have an amendment at the desk.
From New York has an amendment at the desk. The clerk will read the title of the amendment, or read the amendment.
An amendment offered by Mr. Engel of New York.
The staff will circulate the amendments, and the gentleman is recognized for 5 minutes in support of his amendment.
Thank you very much, Mr. Chairman. In line with the answers the Council has just given me, it only reiterates why I think we need this amendment that I am about to put forward. I believe in the right for doctors and hospitals who do not believe in abortion to not be forced to provide abortion services. I think that's only fair. I don't think that anyone should be forced to do something that goes against their conscience or do something that they do not want to do. But I do think that conscience is a two-way street. Provisions of current law, both in health reform and in the long-standing Church Amendment, named for its principal sponsor, Senator Frank Church, protects both doctors who do not believe in abortion and those who do. State laws are not preempted no matter which group they protect. Federal laws are unaffected as they apply to either group, and the Church Amendment protects providers who participate and who refuse to participate in abortion. But the bill we're considering today changes all that. Again, as you can tell, the answers I got from the Council. It changes current law. It changes the balance we have had for these many years and creates a one-way street, protecting only those providers who oppose abortion. Again, I respect those who oppose abortion, and I believe that conscience protection is a very serious issue, but we should not ignore long-standing law and protect one side while at the same time not protect the other side. I'm sure that there are doctors and nurses who believe that they are ethically bound to provide abortion services when the pregnancy endangers the health of the woman. I'm also confident that there are doctors and nurses who believe that they are morally required to provide a requested abortion to a victim of rape or incest, and they should be allowed to do so. Yet my colleagues on the other side of the aisle seem to want to protect only one group's conscience and not the others. This seems wrong to me, particularly since it upends long-standing law and tradition in this country. This doesn't seem like conscience protection. This seems like the government advancement of a particular viewpoint on abortion. And it's wrong to say, as a majority witness did in a subcommittee hearing last week, that these protections are already provided by Roe v. Wade. It's not true, and it's ridiculous. If a hospital fires a doctor because he performs abortions elsewhere, that's not protected by Roe v. Wade. If a nurse is not given a job because she has provided counseling on abortion, that's not protected by Roe v. Wade. If a hospital chooses to provide training on safe abortion methods and is denied a grant as a result, that's not protected in Roe v. Wade. If a clerk outside a hospital says to a woman, sorry, we don't provide abortion services, but the clinic 10 blocks down the street does, that person can be fired. We should not protect one group's conscience and criminalize another's. It's not fair and it's not right. We need the two-way protections that exist in current law, and my amendment provides that. I'd like to make clear that my amendment does not include protecting the woman's conscience, which I think is really the one which needs to be protected. We talk about everybody else's conscience, but the woman who has to make the choice about whether or not to have an abortion, we somehow disregard and throw away her conscience as if she's a being or a piece of stone. Her beliefs, her conscience doesn't count. But I know we're not going to win that fight. My amendment just deals with health care providers and doctors. If a woman makes the difficult decision to have an abortion or is in an emergency and needs to access one to save her life, then doctors should be allowed to do the procedure without penalty. I now yield to Ms. Capps.
Thank you for yielding, but I'm going to wait to get my own time.
Okay. Okay, thank you, Mr. Chairman. Then I yield back the balance of my time.
Gentleman yields back his time. Are there other members wishing to speak on the amendment? Gentleman from Kentucky, Mr. Guthrie.
Thank you, Mr.
Recognized for
Chairman.
5 minutes.
This amendment changes the conscience protection to prohibit a federal agency or state or local government from receiving Health Care Act funds from discriminating against any healthcare entity because the entity requires training for abortion, performs abortions, or covers or pays for abortions. This amendment would make regulatory enforcement of laws regarding abortion subject to litigation. While the bill does prevent preemption of state laws, enforcement of laws would be considered discriminatory and subject to litigation because they treat those who perform abortions differently from those who do not. Implementation of the first half of the Pitts bill, preventing federal tax subsidies to health plans that cover elective abortions, could itself be nullified because it discriminates between plans that cover abortions and those that do not. This change could even result in a backdoor Freedom of Choice Act that provides a legal basis to overturn any enforcement of any state or federal laws that regulate or restrict abortion by calling such enforcement discriminatory. The Gosnell situation in Pennsylvania demonstrates that more, not less, regulation of abortion providers is necessary. In the Gosnell case, the state failed to do proper inspections or comply with Pennsylvania Abortion Control Act. Under this amendment, if the health department had targeted Gosnell Clinic for investigation, as certainly was warranted, Gosnell would have had the grounds to sue the state. The change is also internally inconsistent. For example, the bill's underlying conscience protections ensure that government programs cannot require training in abortion because such a requirement discriminates against individuals who do not participate in the practice of abortion. This law adds a contradictory provision protecting the requirement for abortion training, thus helping to violate the conscience of any applicant who is opposed to doing abortions. At best, this is an ambiguity in the law. I yield back.
Gentleman yields back his time. Are the other members? The gentlelady from California, Ms. Capps.
Thank you,
Recognized
Mr.
for 5
Chairman.
minutes.
Thank you. I think we all can agree that this topic of conscience clause is sensitive. While there are medical professionals who do oppose abortion, there are those that believe that they are morally and ethically bound to perform those services if the situation warrants. However, as counsel even underscored, this extreme legislation is one-sided and would allow Congress to deem who is worthy of conscience protections and who is not. So I believe we should see how this would play out in the real world. And this is a concrete example that I want to relay. And it's from the director of the section of family planning and contraception at Northwestern University. His name is Dr. Hammond. Through his work, he's seen the gauntlet of instances where, despite that pregnant woman's intentions to carry her pregnancy to term, it is sometimes not possible. He recounts the following story of a patient with a rupture of the amniotic sac at 20 weeks gestation. The patient had a complete placentia previa, a condition where the afterbirth covers the opening to the uterus. Although the patient hoped the pregnancy might continue, fervently hoped, she began contracting and suddenly hemorrhaged, losing nearly a liter of blood into her bed in a single gush. Had his team not quickly intervened to terminate the pregnancy, she would have bled to death. If Dr. Hammond was working in a hospital that refused to allow him and his team to provide the range of services needed to save her life, she would have bled to death. And this is what happens in sub-Saharan Africa, in countries with limited access to obstetric services. If they choose to act despite the hospital's policy, the providers who saved her life would be out of a job. Despite the arguments from the other side, this protection is not currently offered by Roe, and many doctors and nurses who perform abortions or provide counseling are routinely discriminated against. That's why all providers should have access to conscience protections, whether or not their views conform with those on either side of the aisle. That's an issue of fairness. That is what this amendment is about. I believe we have an obligation to support this amendment, and I urge my colleagues to do so. And now I will yield to my neighbor, Ms. DeGette.
Thank you very much. I just want to, I've been sitting here thinking, and Mr. Engel, I want to thank you for bringing this amendment. I've been sitting here thinking about Mr. Engel's colloquy with counsel about what the intention here is, because according to counsel, the Church amendment, which applies both directions to the conscience clause, either people who are opposed to providing abortions or who who want to be able to provide this legal service to women. It applies across the board in the Public Health Service Act. So the question is then, what is the intention here? Because a court interpreting the legislative intent, either they could say one of two things. Number one, as counsel said, they could say, well, they apply side by side, so that in the cases that that particular act applies to, then the Conscience Clause would go both ways. But here, under a much broader act, it would only go one way. And I don't really understand what the intention is, because if the intention is to make this law parallel with current law, you would adopt the Engel Amendment. It would make sense to say Conscience Clause goes both directions. And in addition, as I've been sitting here thinking, I think there might be some constitutional problems with this too, because you can't simply give one set of providers a Conscience Clause and not the other set of providers. So not, I mean, if this amendment were not adopted, I think what could well happen would be, aside from years of litigation, would be that you would have disparate results in the law. And like all of my colleagues said, I think it was recognized years ago in Congress that these things can and should go both directions. And frankly, from my perspective as the co-chair of the Pro-Choice Caucus, I also agree that people should be able to exercise the Conscience Clause. I also agree that if a provider has a moral opposition to providing abortions, they shouldn't be forced to do that. But on the other hand, I think that if somebody wants to provide that service, they should not be discriminated against for doing that either. And I frankly really can't understand why anybody would say otherwise. And with that, I thank the gentlelady for yielding, and I yield back.
Gentlelady yields back her time. Are there other members wishing to speak on the amendments? Seeing none, I think we're ready for the call on the question. Those in favor of the amendment offered by the gentleman from New York, say aye.
Recorded vote, please.
Recorded vote is asked for. The clerk will call the roll.
Mr. Barton, Mr. Stearns, Mr. Whitfield, Mr. Shimkus, Mr. Shimkus, no. Mr. Pitts, Mr. Pitts, no. Mrs. Bono-Mack, Mrs. Bono-Mack, no. Mr. Walden, Mr. Walden, no. Mr. Terry, Mr. Terry, no. Mr. Rogers, Mr. Rogers, no. Mrs. Myrick, Mrs. Myrick, no. Mr. Sullivan, Mr. Murphy, Mr. Murphy, no. Mr. Burgess, Mr. Burgess, no. Mrs. Blackburn, Mrs. Blackburn, no. Mr. Bilbray, Mr. Bilbray, no. Mr. Bass, Mr. Bass, no. Mr. Gingrey, Mr. Gingrey, no. Mr. Scalise, Mr. Scalise, no. Mr. Latta, Mr. Latta, no. Mrs. McMorris-Rogers, Mrs. McMorris-Rogers, no. Mr. Harper, Mr. Harper, no. Mr. Lance, Mr. Lance, no. Mr. Cassidy, Mr. Cassidy, no. Mr. Guthrie, Mr. Guthrie, no. Mr. Olson, Mr. Olson, no. Mr. McKinley, Mr. McKinley, no. Mr. Gardner, Mr. Gardner, no. Mr. Pompeo, Mr. Pompeo, no. Mr. Kinzinger, Mr. Kinzinger, no. Mr. Griffith, Mr. Griffith, no. Mr. Waxman, Mr. Waxman, aye. Mr. Dingell, Mr. Markey, Mr. Markey, aye. Mr. Towns, Mr. Towns, aye. Mr. Pallone, Mr. Pallone, aye. Mr. Rush, Ms. Eshoo, Ms. Eshoo, aye. Mr. Engel, Mr. Engel, aye. Mr. Green, Mr. Green, aye. Mrs. Capps, Mr. Doyle, Mr. Doyle, aye. Herman, Ms. Schakowsky, aye. Mr. Zoss, Ms. Baldwin, aye. Ross, Matfield, Mr. Aye. Mr. Stearns, no.
Mr. Barton?
No. Mr. Barton, no.
Are there other making nomination to vote? Seeing none, I'll let the count. Mr. Nominations for
some circle that we prove underpinning for a bill be still when a constitution to enact the bill joint resolution. Mr. has this legislation pursuant to what was acknowledged at the subcommittee amendment except for this one. In a moment, that's going to clarify. That's going to say that this mistake was made. It was not a lethal mistake, but it was a mistake, and it's our first bill that we're hearing here. Let's make sure we get it right. And it is going to say that that a correct one has to be put in the congressional record before the bill can go into effect. It can be tomorrow. But just so that we do it and we don't start off saying that just about anything we put in is going to satisfy that. Mr. Barton, in our debate in subcommittee, actually put it right. He said, well, it's a law and any law amends the Constitution, therefore we can really put anything in, and this was inartful. Okay, inartful is one way to put it, but it clearly wasn't in compliance with the law and with our rules, and I want to caution my colleagues, if we don't clean this up, then we will lose any ability to enforce that rule hereafter. So what my amendment says, and it's pretty clear, and we're going to get to it in a moment, is it says the whereas clauses are the three questions I just asked counsel, and the resolve clause simply says that the provisions and amendments to this law, whether you're going to vote yes or no on it, and I think it's going to wind up passing, I can count, with your yes or no on it, it doesn't go into effect until something's been put in the congressional record to clarify the constitutional underpinning, and I yield back the unconsumed time.
Gentleman yields back his time.
Mr. Chairman.
Gentleman from New Jersey.
Asked to strike the last word.
Gentleman is recognized for 5 minutes.
Mr. Chairman, I wanted to I'd ask unanimous consent to submit to the record a letter to yourself from myself and Mr. Waxman with regard to the issue that Mr. Weiner has just raised. If I could ask unanimous consent.
Without objection, the letter can be entered into the record.
And Mr. Chairman,
can we see the letter?
Yeah, I'll give it. We already sent it to him, but I'll give you another copy.
He's putting the letter into the record.
What
Put it in the letter.
The point I'd like to make, and it's the same point that's in the letter, and Mr. Weiner has stated it very succinctly, is that if there's not some opportunity, either here in the subcommittee or at some point, to raise this constitutional issue, then I don't really see what the point is. I mean, the way I understood the council during the subcommittee, basically the council said that as long as or maybe some of the members said, as long as Mr. Pitts submitted some statement, even if it didn't reference the Constitution in any way, or certainly raise or in any way specify why his legislation was constitutional, that was okay. And it was unclear when the opportunity would be to question the basis for the constitutionality. In other words, if I submit a bill and I simply say, okay, here's my statement about why it's constitutional, but I don't cite any section or explain in any way why it's constitutional, just issue a statement of any purpose, that's sufficient. And I just think that makes a mockery. I mean, as the letter says, it makes a mockery of the rule requiring submission of a statement of constitutional authority. The reason the statement is submitted is because you want to show that your bill is constitutional. If you don't have to say it is, or there's no discussion about why it is, I don't see why there's any point of even having the statement, and the whole thing becomes absurd. So it just seems to me, and it also raises the issue about whether or not Mr. Pitts even has the ability to explain why his legislation is constitutional, and I don't think it is. So, if he doesn't have to say why, then we can all submit things that are not constitutional and not have to worry about it because it never comes up. So I just think that this is a very important issue, and it was raised by the Republicans, by the Tea Party. We read the Constitution on the floor. I participated in it, although I was interrupted by one of the birthers, but that's another story. And
don't go there.
The point I'm trying to make is you guys are saying over and over again that the Constitution is important. Don't make a mockery of the Constitution by saying I can submit something. It doesn't have to say any basis for the constitutional authority. We don't have to discuss it at any point, and that's sufficient. I think that's wrong, and that's why we sent this letter asking that the bill not be considered unless the statement of constitutional authority was given. And I want to join with my colleague, Mr. Weiner, who I think has an amendment to try to correct this.
Would the gentleman yield his remaining?
Certainly, I yield to Mr. Weiner.
if I can just make clear something here. Nothing about this amendment anyway slows down the process at all. This isn't going to go into the force of law tomorrow, and yet it could be cleaned up in the congressional record tomorrow. And one thing that I would observe, that's something that we did in the majority, that this is an opportunity to show that maybe you've learned some of the lessons we've taught you, is that sometimes there's this instinctive thing, well, they proposed it, we got to be against it. This is actually something that is going to help. You know, I believe, you know, I believe we should have fidelity to the rules. This also places a foundation on which we say that, you know what, there are going to be some mistakes that are going to be made. There's a new leadership, Mr. Upton. You know, he's got 2 years as leader here. He shouldn't get too comfortable, but I want him to be a success. One of the ways we can do it is to make sure that we say, you know what, when we identify slip-ups like this, let's go ahead and fix them. And I would want to make one final point for anyone new to this discussion. This is not about whether the bill is constitutional or not. I believe violations of the Fourth Amendment are a pretty big deal. Some people who support this bill don't feel that way. That's not the issue. The issue is whether or not we are going to put the language in that points to the specific section of the Constitution. You can look at today's congressional record. Every single bill introduced yesterday had it right. And this is a way to clear it up without costing us a moment of enactment time, without advancing this much further, but it's a way to remedy something we all basically acknowledged existed in the subcommittee.
And in addition to that, if I could take back the little time I have, and the only way that's going to happen is with the Weiner Amendment.
Gentleman's time has expired. It's my understanding that the gentleman from New York has an amendment, and it's my understanding that it may be the last amendment to the bill.
Yeah, I will.
Gentleman, or the clerk will report the title of the amendment.
Mr. Weiner, is it AMD 10? Okay. Amendment offered by Mr. Weiner of New York.
Without objection, the
Mr. Chairman.
gentlelady from North Carolina.
Yes, thank you. I reserve a point of order.
Chairman. As I explained earlier, it's very simple. One, the first section of the findings just reiterates what the House rule is. The second section of the findings restates what the statement that was made and attached to the bill. The third states the obvious, clear fact that there is no reference to congressional a section in the Constitution. And the third section, the enactment and constitutional authority requires just says that until someone submits the congressional record a corrected statement, then this can't become a live bill. It won't be anyway. We have to wait for the Senate to act on this anyway, so it doesn't cost anything. And just to further explain for those of you who haven't read the rule as carefully as I have, what the rule says is not that you can put anything in explaining why you think it's constitutional. It specifically says a bill or joint resolution may not be introduced unless the sponsor submits for printing in the congressional record a statement citing as specifically as practical the powers granted in the Constitution. So it has to allude to a section, an article, it has to allude to an amendment, and that didn't get done. Let me just, that same day that 358 was introduced, there was a bill by Ms. Richardson citing Article 1, Section 8, Clause 3. Ms. Blackburn had one that day, citing Article 1, Section 8, Clause 3. Ms. Fox had one that day, Article 1, Section 8, Clause 18. Mr. Kildee had one, Article 1, Section 8, Clause 3. The simple fact is everyone's gotten it right except for this bill. This is a remedy. It's a simple remedy. It's a way for us to proceed forward. And if the point of order is insisted upon and I'm ruled against, I have other amendments that will be in order that I think will address this, just not as artfully as this amendment. And with that being said, if no one seeks my time, I yield back my time.
Gentleman yields back his time. Does the gentlelady insist on her point of order?
Yes, Mr. Chairman, I regret I must insist on the point of order because the amendment violates Clause 7 of Rule 16 of the Rules of the House because it's not germane to the underlying bill.
Mr. Chairman,
the amendment deals solely with the operation of a new rule of the House and its application to debate in this committee. The underlying bill, in sharp contrast, deals with certain carefully defined matters under the health care law enacted last year. The two have nothing to do with each other. The amendment is therefore not germane, and I insist on my point of order.
Gentlelady insists on her point of order. Would the gentleman like to respond to her point of order?
I'd like to be heard on the point of order.
Gentleman is recognized to respond to the point of order.
If the chair is to uphold the point of order, he would be stipulating to the notion that the constitutional underpinning of these laws in every committee, not just here, in every committee, are not actionable, meaning that we would have a rule with no effect, meaning that the only way to enforce the rule is to ridicule it. The only way to enforce the rule is to just hold up your hand and say you didn't follow it. In order for a rule to be a rule, it has to be actionable in some way. And to rule in favor of the gentlelady's point of order would be to say, you know what? It's a rule, but it's not really a rule because it's not germane to anything except the House rules. I mean, frankly, it's mind-boggling because think about this, my colleagues. You can contest the House rule when the rule is passed. At the beginning of Congress, the rules come up, we can have a debate, we can go back and forth.
Would the gentleman yield?
Okay, I was just reaching my crescendo, but you know, Mr. Barton.
That's why I asked. I've had a discussion with Chairman Upton and our staff. We accept the premise of what you're trying to do. The problem is if they accept the amendment that's not germane, it puts it in the bill, and that in itself could be a problem if and when this bill goes to the Senate. If you're willing to work with Chairman Upton, though, he is very willing to get with you and Chairman Pitts and work something out so that before the bill goes to the floor, it'll be like you want it.
How about this? I will accept.
At least that's my understanding.
That's reclaiming my time. Here's what I will think. Is I don't want to do anything. I was going to say I don't want to do anything to slow up the bill. That's not really true. But here's what I would accept. If Mr. Upton, if you as chairman of the committee would be willing to essentially put these three findings and a clarified statement of constitutional authority in the record, freestanding, just to say, look, this wasn't in there. We know it's the rule that it should be in there. This is to clarify, just as a freestanding statement of the congressional record, I would accept that because I think then we can go back and point to it as an attempt to remedy the shortcoming if this ever comes up in the future. I would accept that and would withdraw my amendment under that circumstance. I mean,
yeah, I'm not prepared to do that, but I am prepared to rule. Would you like to?
Well,
Would the gentleman,
Well, let me continue my I mean,
Go ahead,
interrupted with an offer of a compromise, and I thought I responded with a fair one. Look, the point is that I was making is that if you are saying, and if you rule this way, you're saying that the only place to enforce the rules that we agree upon for our behavior is at the very first day, and that if someone violates those rules day by day, we in the committee are powerless to insist upon their enforcement, then in fact you're saying the rule is null. You're in fact saying, you're saying that Mr. Pitts, although he stipulated that no constitutional authority was stated, no section in the Constitution is required by the law, if you say, well, the only time to do that because of the point of order raised by the gentlelady is absent a bill, then why would you ever have to include it? And I think you're going to see members who are going to simply say, okay, then why, if there's no enforcement mechanism and you can't enforce it in committee and you've already missed the chance to enforce it on the floor, because how would I be able to anticipate? How would I know Mr. Pitts was going to put the language in wrong back in January 10th, which would be the meaning of your ruling? So I believe that having this language clarifies it, it strengthens the bill, it makes it clear we're going to take the rules seriously, and I would urge you to rule against the point of order and let us go to a vote on the bill.
would the gentleman...
Chair is prepared to rule.
Mr. Chairman.
Before I do, I'll be glad to have further discussions with the gentleman from New York, but as the gentlelady noted, Clause 7 of Rule 16 of the Rules of the House prohibits the committee from considering non-germane amendments. The precedents of the House set forth several general tests for germaneness. Having reviewed the amendment and listened to the arguments, the chair finds that the amendment does not concern itself with the same subject as the underlying bill, and therefore the chair sustains the point of order.
Mr. Chairman.
Gentleman from New Jersey.
Mr. Chairman, strike the last word. I know that you had offered to address this at some point when it goes to the floor. My only request is that it's addressed in a fashion that basically provides the constitutional authority. In other words, between the subcommittee and the full committee, you know, Mr. Pitts could have put something in the record explaining what the constitutional authority is. And I think that it's necessary that whatever you do between now and go to the floor, express that. That's what I would like to see.
I'll be glad to have further discussions with the gentleman from New Jersey, but the amendment has been dispensed with as it was ruled non-germane. Are there further amendments to the bill? Mr. Gentleman from New York.
Mr. Chairman, I reserve the right to object.
Gentlelady from, no, wait.
Excuse me, I reserve a point of order.
Clerk will report the amendment first. Sorry.
An amendment offered by Mr. Weiner of New York.
Gentlelady from North Carolina.
Yes, I reserve
and the gentleman is recognized for 5 minutes in defense of his amendment.
Thank you, Mr. Chairman. This is a far less artful way to do it, but it is clearly germane. I don't think I need it. That's what you get when you get the chump seats down here. This has some slightly different findings, but it goes to the same point and then concludes by striking the enactment clause, which unfortunately is apparently the only way that you can go about enforcing this rule is to stop the bill in its entirety and make everyone start again. I find it just remarkable that when you have 3 facts which are not in dispute, that there's a rule requiring something, that it wasn't done, and that we should want it to be done, that we can't just arrive at some common sense solution to this problem. To say that it is not germane, whether it's constitutional or not, is stunning. I mean, the whole mantra of this Congress was that we're going to make sure there's constitutional underpinning of every single thing we do. And we just heard in the last ruling that the germaneness of the Constitution, that the constitutionality is not germane. I mean, I just don't understand the inconsistency here. Now, the irony, and maybe that's what you were pursuing, is irony, of having a law that diminishes women's Fourth Amendment rights, and then when it fails to have any constitutional authority stated, it's ruled not germane whether it's constitutional. Is this really the way we're going to function? I mean, I say to my colleagues, you know, we had a debate in the text of the bill about whether or not the stated objective of clarifying Hyde was really just a subterfuge for wanting to dramatically expand the infringement on people's constitutional rights. And it turned out, in questioning with counsel, that was what it was about. Now we say that the desire to follow the Constitution is really an option. It's really not even germane to our discussions. That was the literal ruling of the chair, that it's not even germane to this bill.
It's basically the same.
I mean, I would think that at least we'd get through February before the phoniness of the adherence to the Constitution becomes apparent. I thought we'd at least get to, I don't know, March Madness or something. I didn't think that already in our first markup we'd be saying the words, the constitutionality is not germane to this discussion.
That's not what he said.
And yet that's where we are. And now, I guess the door is open now. Now, whenever a bill you want to introduce anything, that you can just write anything in the whereas clause, in the constitutional underpinning clause. We read the Constitution on the first day, and in the second month, in the first markup, we start saying that it's not germane to our conversations. Well, I think it should be germane. I think the Constitution's a pretty important thing. I guess it's the same psychology that goes into saying I want limited government, and I want government not getting between doctors and patients, except if you're a woman who wants reproductive health care. Then we want doctors having congressmen in their way, rules writers in their way. Now, I heard we want state legislators in their way. You want a room full of people when it comes to a woman's right to reproductive health. And the same hypocrisy is existing here. You made a mistake, I thought. You forgot to put something in, I thought. No. It's not germane, we're hearing. The Constitution isn't germane to this conversation. Stop with the Constitution. Stop with all that stuff. We read it. Isn't that enough? Even though we got that wrong, too. I read it the next day. I mean, the fact is, we should take this a little bit more seriously. And if we find a mistake, let's have the gumption to say, you know what, I made a mistake. Here's a simple way to fix it. Instead, the answer is, that's not germane. The Constitution isn't germane in this case. Well, now we have another version of the amendment, and I have 6 others here ready to go. This one says we're going to strike the whereas clause. And in this case, in case it wasn't, the last one was too subtle, this one has sections of findings with other examples written by Speaker Boehner on how it's supposed to be done. This is not my rule. I like it, but it ain't my rule. It's yours. You won. You wrote the rule. Why don't you want to enforce it here today? This is not germane. Let someone else do it. This is like already we're the committee that says let someone else fix things. We're the Energy and Commerce Committee. Mr. Dingell used to have a picture in his office of the Earth photographed from the moon, and when people would say, Mr. Dingell, what's that a picture of? He would say, that's the jurisdiction of this committee. No, on this day, the Constitution isn't even in our jurisdiction, and that's regrettable. I call for a yes vote.
Mr. Chairman.
Does the gentlelady insist on her point of order?
Yes, I do insist on the point of order. The amendment violates Clause 7 of Rule 16 of the Rules of the House because it's not germane to the underlying bill. The amendment deals solely with the operation of a new rule of the House and its application to debate in this committee. The underlying bill, in sharp contrast, deals with certain carefully defined matters under the health care law enacted last year. The two have nothing to do with each other. The amendment is therefore not germane, and I insist on my point of order.
The chair is prepared to rule. As the
on the point of order, Mr.
noted,
Chairman, I mean, we're just going to
ruling on
continue. I understand, but he's going to have another 5 or 6 amendments.
He can put them on block if he'd like to.
Well, Mr. Chairman, all I'm asking is, could you explain what you intend to do in order to address this?
Let me rule on this, and you can strike the last word.
All right.
As the gentlelady noted, Clause 7 of Rule 16 of the Rules of the House prohibits the committee from considering non-germane amendments. The President of the House set forth several general tests for germaneness. Having reviewed the amendment and listened to the arguments, the chair finds that the amendment does not concern itself with the same subject as the underlying bill and therefore sustains the point of order. Does the gentleman from New Jersey wish to strike the last word?
Yes.
Gentleman is recognized for 5 minutes.
Mr. Chairman, look, both myself and Mr. Waxman sent you a letter, which is now in the record on this issue, Mr. Weiner has now brought up 2 amendments. He says he has others. I know you made a statement earlier that you were going to try to address this.
The gentleman will yield.
Yes.
I look forward to reading the letter that has been put into the record and responding. I've not had a chance to do that since I've been sitting in the chair.
No, I understand that.
I look forward to doing that and
Well,
getting it done on an
giving back
expeditious
my
basis.
time, what I'm asking, Mr. Chairman, is you made a statement earlier about how you were going to try to address this. I didn't quite understand what you meant. Would you clarify a little better how you intend to address it between now and the full committee?
Well,
are we going to have a discussion? What are we going
Be
to do?
glad to have a discussion. I'd like to read and review the letter. I'll respond to the letter. At that point, we can sit down and discuss not only your letter to me, but my response back. Not had a chance to do that since the letter's been put into the record.
All right, yield to Mr. Waxman.
I thank you for yielding. I would hope that the idea behind the Weiner Amendment gets accomplished as a practical matter, and I would urge that the sponsors of this legislation, who are also the sponsors of the House rule to require the identification of the Constitution that would allow such a proposal to be offered, would review this and decide to put in an accurate statement as to the constitutional authority for the bill. I would just, it sounds to me like the chairman is willing to look at that, and I would encourage him to do it.
I yield also to Mr. Inslee.
We would appreciate the chair thinking about this too, and the reason is, when we started this discussion, when we thought about the constitutional aspects of this bill we're working on, we were all thinking out of the chute just about Roe versus Wade, a woman's right of privacy and a right of choice. But now, while we're going through this, we find out that there really is an effort to reduce a woman's and a man's right to contraceptive services. And when you start to impinge on an American's right of contraceptive services, that's another constitutional principle in Griswold versus Connecticut. And in answer to Mr. Shimkus, he argued that emergency contraception was abortion. That is simply not the case. Any scientific review will show that the abortificants that he refers to are dramatically different than the emergency contraception that is now used to great effect by many of our constituents. And I just hope that we will have a discussion of these constitutional principles, because now the Republican effort to reduce people's access to contraception is really affecting another constitutional right that the Supreme Court has identified. So I hope the chair will think about that. Thank you.
Thank you. I just, before my time is up, I appreciate what you're saying, Mr. Chairman, but I think that Mr. Inslee makes a very good point, which is that, you know, I felt from the very beginning the reason there was no constitutional statement was because there couldn't be. And because of the debate today on these issues of going beyond abortion, I think there's a real issue here of how overreaching this legislation is, and that overreaching directly relates to the Constitution and the issue of privacy under Roe v. Wade, among other things. So I think this is a very important issue that Mr. Weiner has addressed, and I appreciate the fact that we're going to have further conversations about it, because I think it's really important. I yield back.
Gentleman yields back. I'm going to yield for 1 minute to the gentleman from Illinois to talk about the next hearing. Mr. Shimkus.
There is a hearing scheduled for my subcommittee and Gene Green as ranking member. The intent was to go on time, but I really have to ask my colleague from New York if he's still offering 5 amendments, and we'll have to postpone that until votes on the floor or until the last vote here. So I'm trying to get some conclusion. Can I yield to my colleague from New York? And if we're going to...
Well, I was going to strike the last word to engage in one final colloquy with the chairman to try to resolve this, to obviate the need for any further...
It's the chairman's time. So.
Gentleman from New York is recognized to strike the last word.
I strike the requisite word. Mr. Chairman, you have you've never been dishonest with me. You've always lived up to your commitments, and I take you to...
By the way, I do take affront at saying that you are in the cheap seats. You are in the dugout. We may be at home plate, but you are in the dugout.
Thank you, sir. I'm also closest to the exit, which might be useful in this committee. Mr. Chairman, can I just engage you in a brief colloquy? Are any of the three things that I've talked about in the original amendment, that the rule requires a specific citation in the Constitution, that the statement that was provided by the maker of was not in compliance with that, and that it's a good thing for us to do, that it's a good rule for us to follow? If I can get you on the record saying those three things, then I know that at least then we can move forward with the same foundation of understanding. If it is really the case that it's your interpretation of the rules that none of these things are germane to our discussions, then I don't know how an off-the-record or private conversation is going to go any different. If we can just stipulate to those three things, which are not contested. I haven't heard anyone say the rule should be thrown out. I haven't had anyone say that the rule doesn't exist, and I haven't had anyone say that the statement of January 20th complied with the rule. So if you can just say that for the record, then I will take that small victory, and when we'll have further discussions offline. I'd be glad to yield.
I just responded as one that did support the rules package. It's my understanding, as we had conversations with the House Rules Committee, that it did comply. Now, could we have done maybe a little better job had we had a little? Perhaps. I'm not afraid to confess that. I will assure you that we'll work very closely to make sure that the rules of the House are followed as we look at legislation from, yesterday and
all right. Well,
days forward. And
I understand, but there's really no. We can all read it together. You don't need to be a lawyer. It says it is citing specifically as practical the power of powers granted in the Constitution. In the Constitution. In the Constitution. It's not a question. You don't need to call the Rules Committee to find that. I mean, the Council answered the question correctly, that there's no citation to anything in the Constitution.
Gentlemen, yield to me.
And certainly, Mr. Waxman.
You're absolutely right. The rule might have been complied with, according to the parliamentarian, only because no one objected to it when the bill was introduced, which means the rule is completely unenforceable. But the language that was put in by the authors of this bill, no one could argue was in response to the rule that required a very specific identification of the constitutional provisions that would allow such a bill to be introduced. So I want to join you in urging the chairman.
Let me reclaim my time briefly. Mr. Upton, can I get your concession on this? Is the Constitution always germane in this committee?
We have a copy of the Constitution if you'd like to read it, but yeah.
No, I'm asking you, Mr. Chairman.
It is.
The Constitution always germane in this committee?
It ought to be, yes.
Okay. Thank you.
All right. I look forward to responding to the letter. Are there further amendments to the bill? Gentleman from Pennsylvania.
I move to strike the last word.
Gentleman is recognized for 5 minutes.
I don't have an amendment, Mr. Chairman, but now that all amendments have been offered, I just want to comment briefly on the bill generally. You would think, by listening to some of the conversations of our colleagues, that current law allows federal funds to be used to fund abortion. It does not. I guess in this day and age, everybody's entitled to their own reality, but I just want to state for the record what current law is. Current law prohibits abortion coverage from being required as a part of the federally established essential health benefits package. This law allows states to prohibit coverage for any abortion by all private plans in their state-based exchanges. The law requires at least one plan within a state exchange not cover abortion services beyond those permitted under federal law. It allows private plans in a state exchange to offer coverage beyond that permitted under federal law, so long as no federal subsidies for premiums or cost sharing are used to purchase such a plan. Only private dollars are used to purchase abortion coverage, and the plan collects 2 separate premiums from all enrollees, one payment for the value of the abortion benefit and one payment for all other covered services. It prohibits private plans from discriminating against any individual health care provider or health care facility because of its unwillingness to pay for, provide coverage, or refer for abortion. In addition to those provisions, The Affordable Care Act has no effect on state laws regarding coverage, funding, or procedural requirements such as parental notification or consent laws. States can use state-only funds to pay for medically necessary abortion beyond those permitted under federal law under Medicaid, or to pay for abortion coverage in plans offered in exchange. In addition, the Nelson provisions have no effect on federal laws regarding conscience protection, on the rights and obligations of employers or employees under Title VII of the 1964 Civil Rights Act, or the obligation of health care providers to provide emergency services as required under either state or federal law known as EMTALA. And finally, Mr. Chairman, President Obama signed Executive Order 13535, which ensures the enforcement and implementation of abortion restrictions included in the Affordable Care Act. This order reinforces the prohibition on the use of federal funds for abortion services under the Affordable Care Act, clarifies that such prohibition applies to community health centers receiving funds under the Affordable Care Act, and directs the Office of Management and Budget to develop a model set of guidelines for state health insurance commissioners to use in determining whether state exchange plans are complying with ACA's public-private dollar segregation requirements. OMB published such pre-regulatory guidelines on September 20th, 2010. So I think it's quite clear that we don't permit federal funds to fund abortion. I voted for this bill. Now, I know my colleagues on the other side of the aisle didn't vote for this bill, and perhaps today is their way of voting for something on their own. But those of us on this side of the aisle, I think, are well convinced that we have gone the extra mile to make sure federal funds are not used to fund abortion. The act that's putting up today, H.R. 358, goes way beyond these provisions in many troubling ways, which was explained today. I, for one, Mr. Chairman, I'm content with what we did in the Affordable Care Act, has protected federal dollars from being used for abortion, and I will not be supporting this bill today.
Mr. Chairman,
yes,
the gentleman.
Yes, I will yield my time to Ms. Harmon.
I thank Mr. Doyle for his careful recitation of the compromise we agreed on last year. This is what I was talking about earlier. It was a painful compromise, and he in particular showed enormous courage to support it. So did Mr. Stupak, our former colleague. And now we're reopening this debate, which I think we should have resolved last year. And I just want to say, Mr. Chairman, that I hope the future markups in this committee will not reopen subjects that are tough, personal, social issues like this one. We will do much better to focus on energy and commerce, which are the names and the title of this committee, where we offer on a bipartisan basis an enormous amount of expertise and where we can really add value. I regret this debate today. I don't know how it will come out, but I do want to say that Mr. Doyle has very carefully put on the record the details of what we agreed to last year, and I wish that we would have left well enough alone.
I yield back my time.
The gentleman yields back his time. Are there further amendments to the bill? If not, the question occurs on favorably reporting the bill as amended in the subcommittee. We'll have a roll call vote. The clerk will call the roll.
Mr. Barton. Mr. Barton, aye. Mr. Stearns. Mr. Stearns, aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus, aye. Mr. Pitts. Mr. Pitts, aye. Mrs. Bono-Mack. Mrs. Bono-Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mrs. Myrick. Mrs. Myrick, aye. Mr. Sullivan. Mr. Murphy. Mr. Murphy, aye. Mr. Burgess. Mrs. Blackburn. Mrs. Blackburn, aye. Mr. Bilbray. Mr. Bilbray, aye. Mr. Bass. Mr. Bass, aye. Mr. Gingrey. Mr. Scalise. Mr. Scalise, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers, aye. Mr. Harper. Mr. Harper, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Pompeo. Mr. Pompeo, aye. Mr. Kinzinger. Mr. Kinzinger, aye. Mr. Griffith. Mr. Griffith, aye. Mr. Waxman. Mr. Waxman, no. Mr. Dingell. Mr. Markey. Mr. Markey, no. Mr. Towns. Mr. Towns, no. Mr. Pallone. Mr. Pallone, no. Mr. Rush. Ms. Eshoo. Ms. Eshoo, no. Mr. Engel. Mr. Engel, no. Mr. Green. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Mr. Doyle, no. Ms. Harmon. Ms. Harmon, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross, aye. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Matheson, aye. Mr. Butterfield. Mr. Butterfield, no. Mr. Barrow. Mr. Barrow, no. Ms. Matsui. Ms. Matsui, no. Mr. Upton.
Votes aye. Mr. Whitfield.
Mr. Whitfield, aye.
Dr. Gingrey.
Dr. Gingrey, aye.
Mr. Sullivan.
Mr. Sullivan, aye.
Dr. Burgess.
Dr. Burgess,
Aye. Mr. Rogers from the great state of Michigan.
Mr. Rogers, aye.
Are there other members wishing to vote that have not cast their vote? If not, the clerk will report the tally.
Mr. Chairman, 33 ayes, 18 nays.
33 ayes, 18 nays. The bill is, gentleman from Illinois, Mr. Rush. Mr. Rush is not recorded. How would you like to record yourself? Mr. Rush votes no.
Mr. Rush, nay.
So the clerk will give me a final tally.
Mr. Chairman, 33 yeas, 19 nays.
33 ayes, 19 nays. The ayes have it. The bill is reported favorably. The committee will now turn to the Oversight Plan for the 112th Congress. The chair offers a resolution to adopt the Oversight Plan that reflects language agreed upon by both the majority and the minority. Clerk will read the title.
Resolution offered by Mr. Upton.
Without objection, the text of the resolution will be considered as read. The chair recognizes himself briefly. Under the rules of the House, the committees are required to adopt an oversight plan and submit it to the Committee on Government Reform and House Administration by today. The oversight plan before us today sets forth some markers on what this committee intends to do on oversight during the Congress. The plan does not limit in any way the matters that we may decide to look into during the next 2 years. Since we circulated the plan on Friday, majority and minority staff of the committee have reached an agreement on a number of improvements reflected in the resolution now before us. I should note that the committee's oversight efforts will focus on 1, cutting government spending through the elimination of waste, fraud, and abuse; 2, increasing individual liberty and personal freedom by identifying and eliminating burdensome government mandates and red tape; 3, promoting economic growth by fostering certainty and stability in the laws and regs that affect job creators. Are there amendments to the resolution? Gentleman from California, Mr. Waxman.
Mr. Chairman, I have no amendment, but I do want to address this resolution. Oversight is one of our core responsibilities as members of Congress. Through vigorous oversight, we can identify waste, fraud, and abuse and save taxpayers money. We can ensure our laws are operating efficiently and effectively, and we can obtain information important for understanding where our laws need improvement. I'm pleased that Chairman Upton and his staff worked with us in drafting this oversight plan. While Chairman Upton's plan has different priorities for oversight than I would pick, that is his prerogative as chair. The plan does cover numerous areas on which oversight is important and necessary, such as examining the costs and benefits of the Clean Air Act, reviewing issues relating to the safety of our food and medical devices, investigating Medicare and Medicaid fraud, and evaluating our national energy policy. Moreover, the language of the plan reflects productive discussions between the majority and minority committee staff. For these reasons, I urge support of the plan. I also want to thank Chairman Upton for agreeing to join with me in inquiring about the, just a minute, is this something we can talk about? Or was that
It's Michael's.
Is it okay to talk about? Okay. For agreeing to join with me in inquiring about the veracity of testimony we received last Congress from Patrick Michaels. Last month we received information that raised questions about Mr. Michaels' claim that he does not receive significant funding from oil companies and other polluting industries. Chairman Upton has appropriately agreed to send a letter with me seeking more information from Mr. Michaels. While I am a strong believer in oversight, I also believe Congress must exercise its tremendous oversight powers thoughtfully and responsibly. With subpoena authority and the ability to call witnesses before public hearings, Congress has the tools to misuse oversight and unreasonably burdensome demands unreasonably burdensome demands or fishing expeditions. I recognize there are members on the Republican side who are opposed to health reform. I respect our differences of opinion, but it would be an abuse of Congress's investigative power to make overbroad or unreasonable oversight demands for the purpose of preventing government officials from carrying out their responsibilities. That is why I've been urging that our oversight requests be tailored to the legitimate needs of the committee. We need to follow the Goldilocks principle. Our requests should not be so burdensome that they interfere with the proper operation of government, nor so modest that they deny us the information we need. They need to be carefully tailored and constructed so they are just right. I hope we can work together to achieve these objectives and carry forward the committee's tradition of vigorous bipartisan oversight.
Will the ranking member yield?
Yes, I'm pleased to yield to the ranking member of the Oversight Subcommittee.
I just wanted to add my thanks to the majority staff and also the minority staff for working together to put this plan in place. I think the Goldilocks principle is one that we should adhere to, but we've already had some good hearings, and I know we're going to have more good hearings in the subcommittee, and the staff play the biggest part in that. So I just wanted to thank the staff.
We, of course, will exercise our conscience in advising Goldilocks on reproductive health issues if we're still permitted to speak our minds on this issue. I yield back the balance of my time.
I thank the gentleman, and again, I want to thank the staff on both sides and the cooperation that we've seen. I think this is a better document than was circulated last week, and we look forward to its adoption. Are there any amendments? Seeing none, no further discussion. The question occurs on the motion. All those in favor will say aye. Aye. Those opposed say no. The ayes have it. The motion is agreed to, and we are done for the day. Oh, are we not done for the day? Yeah, no, done for the day in terms of the full committee. Oh, is there I would ask unanimous consent that the staff may make technical corrections as they may find, and we look forward to the next day. Thank you. Give the gavel to Mr. Shimkus.